Thank you so much. Over to you.
Yeah, thank you so much.
Thank you, Dr. Ba. Thank you so much, everyone.
Thank you.
Yes, so just to establish Dr. Ba's introduction, Dr. Ba is the medical director for Sub-Saharan Africa, representing Pfizer Sub-Saharan Africa cluster. And thank you so much for listening to this goodwill message. And thank you for all you do for sickle cell community. Thank you. Bye-bye.
Who is talking now? Oh, God. They shouldn't allow this thing to...
Push button.
Okay.
Can't see the button.
The banner is there. It's there.
Okay.
Over to you, Chair.
Oh dear, I missed out a little of yes, I missed out a little of Dr. Ba's remarks. Thank you so much, Gloria. I was disconnected. You know how technology works sometimes, so I apologize. But here I am back. And let me just seize the opportunity now to just give this little housekeeping announcement here. That for, because I've seen yes, participants who made entries that are having difficulties, whether with audio or otherwise, can't connect. You can actually join on the live stream on various platforms. We're live streaming on Facebook, on YouTube, on Instagram, so you can join on any of those platforms and follow the program, even if you don't get to link up on Zoom. So good. I have also, thank you so much, Pfizer. We still have a lot of thank you to say to you for making this possible. We'll listen now to Healing Blend. Healing Blend is another partner of ours, and I'm not sure who's speaking here. Is it Adebisi?
No, it's actually Dr. Ware.
Okay, good.
Dr. Charlie Ware.
Okay, Dr. Charlie. Dr. Charlie, we're here for you. Please take it away. And tech team, highlight Dr. Charlie, please.
Charlie.
Thank you.
So, Healing Blend for your support. Always. We're grateful.
Thank you. Thank you so much. This is an amazing opportunity and just a phenomenal way to highlight the importance of sickle cell disease. Here at Healing Blend Global, we are a global company with offices here based in the United States, but offices in Nigeria, Uganda, and also Kenya as well. I myself have sickle cell beta thalassemia, and as the CEO, and being able to really see the life of a sickle cell warrior, it hurts my heart to understand that the education is still not there. So we have several initiatives that we've been going through with various companies, and there in Nigeria, you know, it's not about just the creation of products, because we do have a NAFDAC-approved product for sickle cell disease. In fact, we actually are in the guidelines for treatment of sickle cell disease with our products called Even Flow. But essentially, when we start to penetrate the market there, we saw that the education of sickle cell disease was sort of lacking, not because of the government's not doing a phenomenal job, but it was really about dispelling myths and stigmas that surround sickle cell disease. So our first initiative was to start to partner with NGOs and also other organizations such as Rotary, where we've done testing with sickle cell disease on hundreds and thousands of patients there as well, along with other medical units like Swift Medics and things of that sort. And the purpose of doing that was really about understanding that the earlier we can start to allow people to be educated about this disease, the earlier it is that we can actually make sure that they're not going to be able to spread this. You know, as the doctor said in her presentation originally, that a quarter of the individuals are carrying the trait there in Nigeria. So the more we can allow people to understand that we're not trying to put barriers on them, but protect their lives and protect their offspring, also protect the citizens of Nigeria as well. So our testing has been very, very instrumental, a broad spectrum of that. We also start to create protocols. And our protocols, and the purpose of doing these protocols and education of what sickle cell really is and how it affects the body and how they can actually get themselves out of pain crisis. Because, again, the good ambassadors have already said that, these drugs are not really available. Either they're not affordable or just the economic reasons. So the more we can do at home to teach them how to prevent these sickle cell crises, prevent infections, and also make sure that they're educating themselves as well as their family on what sickle cell really is, has been an integral part of what it is that we actually are doing. So as we start to spread the goodwill notions of education about sickle cell disease, and also the protocols, whether it be how to treat yourself with a cold or flu with sickle cell disease, how to actually treat a pain crisis, how to maintain a maintenance level of not being in crisis for a longer period of time, how to prevent sores, as well as how to make sure that you're going to be stress-free and also exercise well with sickle cell disease. These are protocols that we've made readily available on our website, but also as individuals are purchasing our bottles, we are now making initiatives. So there's going to be a QR code where they can easily scan that QR code and get the help that they need. These protocols that here in the United States people are using every day. It says that in the United States there's only 100,000 individuals with sickle cell disease, and this number is actually, I'll say, a false number. It's way more than just 100,000. I live here in South Florida, and we know there's over 50,000 just here in South Florida. So, however, getting a better account of how many people really have sickle cell disease and actually understanding to educate them about the best way to treat this, and yes, working in an integrative approach, starting with infant education about implementing proper diets, proper exercise, proper supplementation along with the medication, can make sure that individuals are living a long and a healthy life. And this is what we've been doing there in Nigeria for the last 6 years, and I can actually say 8 years. We actually got our first NAFDAC approval about 5 years ago for our supplements. And it's something that we're just so proud of, to be able to offer the individuals there in Nigeria just a way to alleviate the burden and stress and the anxiety of sickle cell disease. So we look for other partnerships. We are in partnership with the NCD Alliance, where we're trying to form a relationship there with the Sickle Cell Foundation. Just a way we can actually overall be able to continue to educate the public about sickle cell. Our podcast, our radio announcements, and also starting to launch more television announcements just about sickle cell on large. Just getting the word out there that this is not a death sentence. We've started social media campaigns where it says that sickle cell is not a death sentence. Another one is you're not alone. I think community is really a huge way for individuals with sickle disease to really thrive and survive. We also have given initiatives and protocols where showing individuals with sickle cell disease thriving in different professions, doctors, lawyers, professional athletes as well. The more we highlight these individuals thriving, it gives hope to other individuals. So our goal and our mission at Healing Bliss Global is really to bring hope to the hopeless. Because we see a lot of anxiety with patients. We see a lot of anxiety, especially the caregivers. Someone just left a comment earlier in his chat right here, says that the parents are more stressed and have more of a strain than the actual warriors. And we're here to support not just the warrior, but their entire community to be able to get over it and get rid of this disease and thrive and not just survive. So I thank you, Sickle Cell Foundation, for giving me an opportunity to give a stance on this and our petition and our hope and our praise as well for this short term and also long term. So thank you so much.
Thank you so much, Dr. Ware. We're going to have to bring you back for another event, actually, because there seems to be lots to unpack there. Thank you very much indeed. And then I'll use this opportunity to again appeal to participants. You can join us on the other platforms, Facebook, Instagram, YouTube. We're live streaming on all these platforms. Please join if you have any problems or challenges on Zoom. And I'll also appeal to our goodwill partners who are giving us Google Mercedes. Let's keep our remarks to like two minutes for the sake of time. Thank you very much. So I'll call on this time. At this time, I'll call on Gansid. Do you have a representative of Gansid here? Riyadh. Dr. Riyadh. Is Dr. Riyadh with us by any chance? I know we are in a totally different time zone. So if you're not able to join, I quite understand. And I may just comment on all 5 foundations. I am so glad to see them nicely gathered in a room, in a hall, participating, and it's just typical. We have a lot to learn from all 5 initiatives. David Tokola, what you're doing in Delta State, the rest of Nigeria has to learn, and we need replication. Thank you so much. Look at how you brought people together, to benefit from this. Thank you so much, David Tokola. We're going to hear from you later in the day. So if we have Gansit, I'll highlight Dr. Riyad. He's here.
Riyad,
if not, we have the Sickle Cell Support Society. Any representative of Sickle Cell Support Society?
Riyad.
Yeah, good morning. My name is Dr.
Oh, can we highlight the speaker, please? Tech team.
Patrick Group. I'm presenting on behalf of the Office of Yagele North, with some unavoidably absent. Also in another meeting of the
Sorry, who's speaking? Who are we hearing from? We can't see you. Can tech team highlight the speaker?
You can't see.
Or spotlight the speaker?
Can you see me now?
You can carry on whilst they try to put you on the screen. But carry on, please. Introduce yourself and carry on.
Okay, I'll just. Okay, my name is Dr. Patrick Moru. I'm a research fellow in Sickle in Africa.
Welcome, Dr. Patrick.
Yeah, so I'll be presenting on behalf of
his video is not up.
Okay, his video is not up.
Okay, let's keep it to 2 minutes, please. Very quick.
Okay, thank you. So I'll just read through. To start by, I want to thank the organizers for the opportunity to attend this.
Can you just chat, madam, and tell her that his video is not up?
2024 was Sickle Cell celebration, bringing staff of the Center of Excellence.
We can't stop spotlighting a video that is not on.
Research and training.
Just put his name. Just put his name there.
Support Society of Nigeria. The Center of Excellence for Sickle Cell Disease Research and Training was established in 2016 with the mandate to carry out basic and translational research in sickle cell disease, aimed at addressing existing knowledge gaps, finding cheaper, safer therapies, as well as innovative ways of reducing the prevalence and burden of sickle cell in Nigeria. CESTA also provides an opportunity for short, medium, and long-term training to produce the skilled workforce required for optimal implementation.
His name is there.
Just chat, madam, and tell her.
It has a multidisciplinary team of basic scientists, education
messaged
in the industry, working in collaboration with investigators from within and outside the country. In fulfillment of the university's role as the University of National Unity, CESTA works in close collaboration with government agencies to make it easy to implement research findings and to translate research policies. The Sickle Cell Support Society was founded at the first Global Congress in Sickle Cell Disease in 2010 with the main objective of advancing the care and welfare of sickle cell patients and by facilitating capacity building, research, and collaborating with government and other non-governmental organizations in the management of sickle cell disease. The Sickle Cell Support Society has a broad membership base in terms of geographical spread, as our members are found in all disease geopolitical zones of the country as well as in diaspora, with zonal representative in its executive. The society has a large pool of experts in sickle cell disease, comprising of individuals with sickle cell disease, parents, pediatricians, hematologists, nurses, and other health workers. CESTA coordinates the activities of the Sickle Cell Support Society as we work together to reduce the burden of sickle cell disease in our community. The society adopted a multi-pronged approach of stakeholders in health education, social science, the arts, and media to promote early diagnosis, increase access to health education, and genetic counseling, and to deliver preventive and therapeutic care. Capacity has also been built to support the immediate role
we seen this on why are we seeing this woman?
Okay, thank you. Have we lost Dr. Peter? Dr. Patrick?
Send a message page is from we are still up. It's from
the network is on
internet.
With a pencil.
Network. Send the message.
So we'll go ahead anyway. We have the NCD Alliance here with us. Adela, where are you here? Actually, we asked Professor Oshibobo to be here with us, but I'm sure because he has 1,001 things on his plate. NCD Alliance, any representative from NCD Alliance? Okay, we'll move on to Nigerian Heart Foundation. I'm hoping that Dr. Patrick can conclude his remarks.
I was battling with ulcer for the past 6 years now.
Let's people, please. Let's speak
Your
well.
friend of mine told me to come
Mute everybody.
Nigeria Heart Foundation.
Stop speaking.
And
Doctor,
somebody
you need to
who is also
Doctor,
controlling
you need
this.
to.
Is somebody else also controlling this? Okay.
Who is speaking?
You just go ahead.
Who is muted?
I'll just stand on
Dr. Demisha, please.
I'm glad.
There you are.
Oh,
Yes, loud and clear.
Right. Standing on existing protocol, because like you have said, we're not spending time. Nigerian Heart Foundation is extremely delighted to be here and be a part of this epic program that is going on. This being a testament of our support for the cause on ensuring that sickle cell disease is no longer a national, cell disease is more than just a health problem. It is a profound challenge and impacts the lives of millions globally, as well as many families within our communities, in our society. And as stakeholders, we are acutely aware of the day-to-day struggles faced by individuals living with sickle cell disease, their families. We know of the pain, the frequent hospital visits. We are aware of the uncertainty of the health crisis. And these are not just medical issues, but human issues that impact significantly on the very core of our society. And so, from the Nigerian Heart Foundation, we pledge our support to the cause of what is being done and what has been said here. We are hoping that as we address these issues, we will look at them comprehensively and look at inclusive measures to overcome them. This means for enhanced research funding. It also means ensuring equitable access to high-quality healthcare and support services for all those that are affected by sickle cell disease, regardless of their social status. It also means engaging in responsible public awareness to raise awareness and combat the stigma that often surrounds this disease. Partnerships are indeed the bedrock of this success. We extend our gratitude from the Nigerian Heart Foundation and acknowledge the commitment, dedication, the relentless effort of this cause by our colleagues from the Sickle Cell Foundation Nigeria. We recognize the invaluable strength and resilience of those living with sickle cell disease in our country. Their courage and perseverance continue to be both a guide and a call to action. We owe it to them to redouble our efforts and to pursue every avenue that can improve equality. As a collaborator, the Nigerian Heart Foundation is committed to advancing the collective goals and to supporting the initiatives that will make a real difference. Together, we can amplify our voice, advocate for necessary policy changes, and foster a healthcare environment where every individual with sickle cell disease receives the care and respect that it deserves. Let us all, therefore, present at this forum, move forward with renewed vigor. Let's be united in our purpose and be determined to make sickle cell disease not just a national priority, but a national victory in Nigeria. We wish the Sickle Cell Foundation, Nigeria, fruitful deliberation at this virtual Townhall meeting. Thank you all for your attention. Thank you.
Yeah, thank you so much. Thank you very much indeed, Dr. Ademisha. I'm really grateful. And yes, Nigeria Heart Foundation has been a partner, operator all the time. We know that all these conditions are under non-communicable diseases. So under that umbrella, we're working together for a long while. Thank you so much for the insights you gave us there.
Okay, you mean
we have
for partners,
well, Lagos State, and we have
all you do, remove spotlight. So
this must be Dr. Wellington.
Yeah, but most importantly,
Dr. Wellington, if you're here, let us know, and the tech team kindly spotlight her.
Good afternoon, everybody. Good afternoon, everybody. Thank you so much for this opportunity to be part of this meeting. I would like to also stand on the existing protocol.
Please, we need to pay attention to what is happening here. Okay, thank you.
I'd like to appreciate everybody for taking time out from their very busy schedules to be part of this meeting. I mean, when Sickle Cell Foundation calls, we know that that is a mighty voice speaking, and then we don't have a choice but to, of course, answer the call. I bring greetings from Lagos State government, from my bosses, from Mr. Governor himself, my Honorable Commissioner, my Special Advisor on Health, my Permanent Secretary, and my Director. I would like to say, we all know Lagos. People say a coup for show. We are not for show. We are for action. And we're always ready to take the bull by the horns and do what needs to be done. We have been in partnership. I mean, besides the fact that the Sickle Cell Foundation, thankfully, is located in Lagos, we have been partners through a lot, and we've worked together on quite a number of things, and we still continue to work together on battling this scourge of sickle cell in Nigeria, and we are hopeful for more victory in this fight. I would like to say that the Lagos State government is, I'm sure Sickle Cell Foundation will bear me witness, is seriously committed to this fight against sickle cell. Not only in Lagos, but in Nigeria. I mean, people say that Lagos is the mini Nigeria. So if anything happens in Lagos, it is a true reflection of a lot of things happening in the country. I mean, if we look at the fact that we have people from all over the country, I mean, in different parts of Lagos, from different cultures, different backgrounds. We have, I mean, take the sample of Lagos and you have an idea of what is actually happening in Nigeria. So which is why the Lagos State government is seriously committed to this battle with sickle cell disorder. The Lagos State government has provided quite a number of things. I'd just like to mention just a few. We started the newborn screening that we do for sickle cell. We have provided the health insurance, which is called Dairy. And then of course we also have provided some services which are highly subsidized and also make our contributions where we can. And then whatever lessons that we take away from here, let us not drop it, but let us take it beyond this meeting so that we can all work together and fight this battle with sickle cell disorder. Thank you very much, everybody. Over and out. Thank you.
Thank you.
Thank you.
Thank you. Thank you. Thank you. Thank you so much, Dr. Wellington. We're really grateful to Lagos State. Yes, indeed, we've been partners for ages and will continue to be. I think ours will be a model to many other entities that want to partner and work together in public-private partnerships. Thank you for your insight there. Thank you very much indeed. I will call now on Dr. Alayo, representing the Federal Ministry of Health, the Honorable Minister of Health.
Dr. Alayo.
Dr. Alayo, please. Dr. Alayo is the desk officer in charge of sickle cell at the Federal Ministry of Health. He's here representing the ministry today. Honorable Minister of Health and Social Welfare.
I've seen
Dr. Ali Pate.
Okay.
If Dr. Alayo is here, tech team, kindly spotlight him. There you are. Hello, Dr. Alayo. Welcome.
Thank you so much.
Remind participants to join on Facebook or YouTube or Instagram if you're having challenges on Zoom. Sorry, Dr. Alayo.
Yeah, thank you so much. Thank you, Dr. I appreciate it. And other colleagues, particularly Professor Adekile.
These people that are talking, they are different from the panelists that we had.
I'm particularly these people that are one of my friends. I think it's something please, some people are talking behind. I think we can.
Let's check.
Yeah, thank you so much. So, it's a great privilege for me to be here today. And of course,
just 6 panelists that we have.
Today is not just any day. It's a day that, as a continuation of the day that was set aside to celebrate World Sickle Cell Day. Yeah, yesterday we had the ministerial press briefing. We had a lot of activity, and today we are having screening in the ministry and for general public. So, Sickle Foundation, say thank you so much for inviting us to be part of your event. Today, of course, we've been a partner, and the partnership has actually blossomed and is still growing. Yeah, we are very grateful. Well, quickly, I will just say what
those
what we are doing
is just the
to make sure that we improve the quality of life of people that are born with sickle cell and who are living with it. Of course, we developed quickly, realized that management of sickle cell disease in Nigeria is not really optimal, and because of that, we developed a national guideline which the Sickle Cell Foundation founder then, Professor Akinyoju, actually led us in that, and of course with other experts, we were able to put together a national guideline. And let me tell you that guideline was and recently we have reviewed the guideline to include other new things that have come up in the management of the disease, because of course management of the disease is evolving. So we have a second edition now, and we also have a policy, develop a policy and protocol for newborn screening. We adopted the universal newborn screening, and that is to make sure that every children that were born in this country were captured as screened, and we are able to identify them very early. And at this point, we have also started training health workers, particularly at the lower level, to make sure that they are able to help us identify these children so that we can enroll them into care, comprehensive care. We have also reviewed our immunization schedule. If you look at the new national immunization schedule, you will see that we have included some vaccines that these children require to make sure that, of course, they don't die before the age of 5. So, and of course, we also make sure that we produce hydroxyurea, and we are also making efforts to see that we improve the use of the urea in our country. Recently, we brought up a proposal to see how we can actually train healthcare professionals, because we see that they are so reluctant in prescribing.
I don't know, I'm not seeing Facebook. It's meant to be on my home page.
No sound, okay.
And people with this disease will be able to live a quality life, devoid of crises and all those Then we are also happy that Sickle Cell Foundation in partnership with Youth, and I think the Lagos State government also been able to put up a center in Youth for bone marrow transplant. We are glad to be associated with that, and we hope that of course this is going to also add value to what we are doing, and also improve the quality of life of these people living with the disease. And then to top it off, awareness, which is the major thing that we are talking about on a day like this, that awareness creation. We need to make sure that a lot of our people are made to know about themselves, and make sure that they know their genetic status, so that anybody that is going into a relationship, you are going to that relationship with an informed.
Is anybody in your waiting room?
No. There's no. We have disabled the waiting room. People can
making sure that these children are trained, so that right from early childhood, we know their parents know their status, and then they drum it into the ears of their children that look, this is your status. Particularly those ones who are AS, so they will know their status, so that as they are growing up, as they are going into an affair or having relationships, they will also they can now demand that this. And therefore, those who are born with the disease, we are also hoping that they can come out of the shadow of the disease, talk about it, be a champion. I know many of them are warriors, but I want them to be champions for sickle cell disease in Nigeria. Let them be, what do you call it? Our ambassadors, like one of the ambassadors that is working with you. Let many of them come out. Let them champion the cause for sickle cell disease in Nigeria, so that more funding, more resources can be allocated to challenge of sickle cell disease in Nigeria. Nigeria is the epicenter for sickle cell disease, and we are supposed to be seen as a country that we're supposed to be pioneering a lot of interventions for sickle cell disease. In fact, many countries are supposed to even come and learn from us, because this is our disease. So, and I think, of course, we've had a lot of people coming up. We have Sickle Cell Foundation, yourself, our centers, our 6 centers, NCD centers that we established, the CESTRA in Abuja, and other study centers that have been set up, screening across the country. So we are hoping that with all these efforts, we can actually say that yes, we are going to impact on the life of these people, but that is not enough. The warriors, as they are called, but I call them, I want them not just to be warriors, I want them to be champions. They need to come together, they need to speak. I want them to be speaking with one voice, and partner with government, partner with other civil society, Sickle Cell Foundations, and other organizations who are working to advance their cause in Nigeria, to make sure that we push the agenda of sickle cell forward. And also in their various state level.
Thank you very much, Dr. Lyon.
Thank you so much. And I hope that
Dr. Lyon.
Thank you so much. Thank you, and over.
Our warriors, our champions are waiting to talk.
Thank you so much.
Thank you so much for your real message.
Thank you so much.
And your partnership. You are always here for us. I want to seize this opportunity to say thank you to you in the presence of everybody, Dr. Lyon, for your constant support.
Thank you.
Personally, from the Ministry of Health, thank you very much. We're grateful. And to all, Dr. Mary from WHO, please send me your remarks. I want us to document it, because time is fast spent. And I think, yes, that will be all for our Google messages. So our partners, our collaborators, say thank you. Thank you for being here. Please stay and listen to the rest of the program. I'm going to introduce our moderator for the event. She's joining us from far away Houston, Texas.
She's the only one.
And I'm so grateful to her for waking up this early Still dark, I'm sure by the time she got up. Dr. Titilopa Fashikwe, MD, PhD. Dr. Fashikwe has been repeatedly appointed to sickle cell-related advisory committees of the Texas Department of State Health Services and currently serves on their newborn screening advisory committee and chairs the Sickle Cell Task Force. Her professional memberships include the American Academy of Pediatrics, the Heartland Southwest Sickle Cell Disease Network, the American Society of Hematology, the American Society of Pediatric Hematology and Oncology, and the Community Input Panel of the NHLBI. I think that would be National Heart, Lung, and Blood Institute, Cure Sickle Cell Initiative. She chairs that. Dr. Fashikwe has a unique perspective of relating to and understanding the need for education, community awareness, support, and medical care, as she's a pediatric hematologist as well as individual with sickle cell disorder. Dr. Fashikwe, I'm so grateful to you, but you've done this so much. You're very good at moderating, and that's why I asked her to cover this training with us. Dr. Fashikwe, I'm going to hand over the reins right now to you, and you take it away. Dr. Fashikwe, please. And please, the tech team, spotlight Dr. Fashikwe. Thank you.
Thank you so much, Dr. Anna. I am extremely honored to be here today.
Sorry, Dr. Fashikwe, just one more thing. You'll be getting more questions in addition to the ones I already sent you. More questions are going to be coming to you directly.
Okay. I'll be looking out for them.
Okay, she's already. Thank you.
I don't think this is me sharing the whiteboard.
Okay. He's sharing something.
Is that from the tech team? I don't know.
No, she's the one.
Can they stop?
Let's stop this.
Okay.
She's the one.
I know
She's the one.
Okay, I passed up it.
I can see your internet is not very strong.
Thank you, Dr. Annette, and thank you to the Sickle Cell Foundation Nigeria. Thank you to our chairman of the foundation, as well as the chairman of the day. It is a pleasure to be here today, and I am excited about our panel. And to start us off, before we get into the depths of the various illustrious and eminent people we have on the panel, I want us to have our first speaker, and I'll introduce her first. And then we will take a short break, and then we will introduce the remaining speakers and have a unified discussion. I will let you know that we received already 60 questions, if not more. And we noted that they fell into 4 categories, and so we're going to cover those when the panel starts. But without further ado, I'm going to announce our first panelist who will kick us off. So if you can begin to spotlight Ms. Bukola Bolaniwa. Ms. Bukola is a lawyer by trade, and I start with that because it defines how she contributes value to the world. But she's also a sickle cell warrior, and she used her experience to become a blood donation advocate and the founder of the NGO Haima. Haima is the Latin word for blood, for those that don't know. And since 2016, she has been championing efforts in Nigeria to improve blood donation. She has partnered with the Lagos State Blood Transfusion Service, and for her work, she has been granted several awards, including the Obama Foundation Africa Leaders and the Queen Young Leaders Award, which she received directly from the Queen. I am going to allow her to share more of her story and to empower us with the aptly titled Sickle Cell Disorder, a National Emergency. What is the state of affairs? Ms. Bolaniwa, thank you so much.
Thank you so much, Titi Lofe. My name is Bukola. I'm a sickle cell champion, like Dr. Annette says. We should kind of promote our sickle cell warrior, like a lot of us in the community call ourselves. So I was diagnosed, I think I was around 3 years old, And what's interesting is that my mom told me that when I was diagnosed, that she went to the Sickle Foundation of Nigeria, and she had these pamphlets which I saw when I was like around 10 to 12 years old. And that was really bear in mind I was born in 1980s, right? So this was probably a couple of years after, and that was really at that time the only source of information that she was able to get about sickle cell disease. So I decided to kind of do this presentation in three formats, and I hope you can all see my screen. So it's basically the past, present, and future of sickle cell and what the state of affairs is. So just to take us back a little bit, and I know that Dr. Annette has done a really great job, and a lot of the speakers as well, on talking about sickle cell and its current state. But if you look back to where we first started from, because the topic of today is Nigeria's sickle cell capital of the world, what is the state of affairs? So sickle cell was first described in about 1910, when the students presented certain symptoms, and a lot of research has gone in Nigeria to kind of see when sickle cell was first kind of described. A lot of people and a lot of anecdotal and evidence suggest that the idea of Abiku and Ogbanje and children that were being born to die repeatedly could have been children with sickle cell at that time, because sickle cell has always been associated with high infant mortality. In 1986, Professor Akinyo, who was an epidemiologist and founded the Sickle Cell Foundation of Nigeria, trained the first genetic counselors in Lagos. And I gave that example of in the 80s, at that time, there really wasn't that much in terms of sickle cell awareness. And what caused it, and all those things. So now, where are we at the moment? I would say that it's now generally agreed that sickle cell is no longer a pediatric disease, in the sense that it's no longer a disease that just affects children. There are lots of adults of various ages living with sickle cell disease. I was really honored to meet Mrs. Onikwe before she passed. At the time I met her, she was 91 years old, and she lived with sickle cell, and she had the most amazing stories to tell of how she said various scientists would come and take her blood and run her tests to actually make sure that she had sickle cell. She had lots of children, she lived a very full life, and she had sickle cell disease. So her image at that time for me was presented a case of hope, right? Because a lot of parents and a lot of the stories that were told in Nigeria is that living with sickle cell, they're not going to live very long, and so on. So seeing somebody like her created a lot of hope for people living in sickle cell. And at the moment we've had, I would say, probably one of the best times medically in terms of breakthrough for sickle cell disease. So the amount of treatment now that we have is unlike any. I remember when I was growing up, we were categorically told that there would never be a cure for sickle cell disease because it's a genetic condition. You're born with it, you have to live with it, all you have to do is manage it, right? And now there's loads of management, so blood transfusions, things to prevent stroke, and obviously hydroxyurea, which helps to increase longevity. And I'm super passionate about blood donation because I've seen how difficult it is for people living with sickle cell who are either chronic transfusions, regular transfusions, or exchange transfusions, how challenging it is for them to get blood. And that's been what I've been focused on for the last couple of years. I did this slide to kind of show some of the current sickle cell treatments that are available. Again, it's a testament to how far we've come in terms of medical breakthroughs. I'm not going to go through each one of them because realistically, a lot of them are not available to people living in Nigeria at the moment. But I think it creates, again, a sense of hope, right? Because we're looking to the future. A lot of people want to know what will the future of sickle cell look like, what will the life of people living with sickle cell be. And a lot of these treatments have, there's still, some of them are in trials, some of them have shown very, very positive outcomes. But at the moment, we in Nigeria are still kind of really focused on getting hydroxyurea, getting folic acid, getting routine medication to people living with sickle cell. But I like this slide to show that there is hope for the future for various types of treatments that can alleviate the various symptoms of sickle cell. And then I want to talk about the social aspect, because for sickle cell, a lot of it isn't just the medical part, right? The social, it's the social aspect of it. Growing up, I remember not knowing a lot of people that had sickle cell disease, and it wasn't because there weren't other people that had sickle cell disease around me. It was because there was really a secretive nature of sickle cell. People really didn't talk about what it was like, what the experience was, especially in the 80s and 90s. But I would say that, especially since I've been doing sickle cell advocacy over the last 15 years, social media has really helped. The younger generation in particular are more outspoken about their condition. They're able to better advocate for themselves. They're able to use the internet to research what their condition is, right? Before, you only had one source of information, which was your caregiver or your doctor, if you were able to see them. But now there's lots of information everywhere. I think particularly the Gen Z and the way they use TikTok and Instagram and so on, they have lots of influencers who have sickle cell disease who are able to come out and talk and then share the different types of complications that they have and how they're managing it. I think also it allows people in Nigeria to be able to hold caregivers to a higher standard, right? Because it's like, if you see how things are being managed in other places, you know that your situation can continue to be managed very well. And then also seeing a lot of role models with sickle cell who are able to share their experience. So we have Lakon, who's an ambassador for Sickle Foundation. We have Adekole, we have people who are doctors with sickle cell. We have doctors, nurses, lawyers, all sorts of people who have sickle cell disease and are able to come out and talk about their experience, talk about their condition openly. It's really a privilege to see that, because again, seeing those types of role models reduces some of the social stigma and also allows a lot of parents and caregivers to seek help when they have children with sickle cell. But in terms of the challenges, and again, this is talking about the present state of sickle cell, I would say sickle cell as a non-communicable is not given the priority that it should be, both at the government stage and at the international stage. And unfortunately, in Nigeria, it seems that our health priorities are set more on an international stage because it tends to go where the funding is going, right? And I was really happy to see the Healy Lens representative on the call, because the need for ongoing research at the moment is extremely limited. If you look at the previous slide I'd shown regarding the current treatments for sickle cell disease, all of them are coming from abroad, right? We're having very, very few homegrown research, homegrown cures, homegrown treatments, even if it's not treatments for sickle cell as a whole, right? We should have homegrown treatments for leg ulcers or things like that are complications of sickle cell disease. And unfortunately, when we don't have as much as we should, we are going to be pumping more funding in that direction. I think what we've been seeing in the last few years is the socioeconomic challenges in Nigeria, how expensive things are, particularly excruciating for people living with sickle cell. About 5 years ago, we tried to work on a scheme to help a bunch of warriors get on health insurance. And what we find is that a lot of health insurance in Nigeria don't want to insure people living with sickle cell, right? Or they insure you and then they say they won't cover you for anything related to your sickle cell. That's a big challenge because the cost of paying out of pocket all the time for healthcare when you with sickle cell is so draining. With sickle cell is an extremely innovative, and that means that no matter how much you save for your healthcare, you can just get one condition and it wipes out all your savings. And so we need proper health insurance, a health funding model for people living with sickle cell so that they're not constantly paying out of pocket. Especially sometimes we have parents who have 2-3 children with sickle cell disease. You can imagine how much that type of healthcare expense is. And so this general economic challenge and the lack of health insurance is something that I think that's particularly where we really need to focus on for our community. mental health, the state of mental health for warriors is really, really abysmal. We see a lot of people talking, about depression, about having suicidal thoughts, because the mental toll of sickle cell is not discussed often. We talk a lot about the pain, right? We talk a lot about the physical challenges of living with sickle cell, but the mental pain of, sometimes looking at your peers and feeling like, why am I the only one who's not able to do this? Why am I the one that's at home when everybody is doing this? Why am I repeating a year at university because of my health challenges? And that can be really, really draining. I think that's another area that we need a lot more resources. Then education and myths around sickle cell. Unfortunately, before this call, we had seen some of the questions that came in, right, around if I get to 16 years, will I die when I get to 16 years old, for example? Or others will say that if you hit 18 years old, after that, you don't have any crisis. Or if you have sickle cell, you cannot get malaria. Or how, sickle cell is passed down and so on. Though we need to do more in terms of education for people to really understand the conditions, for people to access information, and you must never get tired of putting out that information. Then I wanted to talk a bit about general social support around sickle cell. What the Sickle Cell Foundation Nigeria is doing with sickle cell clubs, what we do around warrior support groups, those groups and social connections that we value for people living with sickle cell, because it makes you, number one, feel like you're not alone, and makes you have a place where you can go to and ask questions without stigma. To be surrounded by people who understand what you're going through, it's really priceless, and it's actually part of the things that can help with the mental health crisis that we're seeing at the moment. And something I would really like to really address the urban-rural divide. I started doing my sickle cell advocacy in Abuja, and we would go to like Wabalada, Buari, Kuje, and the level of information in those areas is so different from the kind of things that we're talking about in Lagos, in Delta States, and all these other urban areas. We really need to take the messaging around sickle cell, the genotype testing, the newborn screening to the rural areas. That's really where I think when we talk about the population of 4 million people living in Nigeria with sickle cell, that's where the bulk of the population is, right? And that's where really the care needs to go to. And I wanted to end on this slide. I hope I haven't surpassed my time. I'm trying to be good with keeping to the 15 minutes to talk about the future, right? Like where are we going with sickle cell? Apart from addressing all these challenges, there's data from what I call sickle cell statistics that says that by 2050, the number of people with sickle cell disease is expected to increase by about 30% globally. And if you think about Nigeria being the epicenter of sickle cell disease, like was earlier said, and think about a 30% growth in the number of people living with sickle cell, it tells you that sickle cell at the moment is not going anywhere. We're going to be living with people living with sickle cell for decades and decades and decades to come, right? So really, while it's very important to think about cures and so on, that's going to be out of reach for a very long time. But we need to focus on how
for me now it has sense from my assistant has sent to you.
To have new sickle cell births. Dr. Akishita shared a statistic about 150,000 births of people living with sickle cell.
But Instagram has been
that statistic has been I've been hearing that statistic since I started my
YouTube caught at a point.
And I think that a lot of because we don't have proper sensors and data and so on, I would say that number is definitely increasing, right? Just as our population is increasing. So we're going to live with the boom of people living with sickle cell, and we need to create the avenue and the atmosphere to support people living with sickle cell to live full and authentic lives, not just healthy lives, because healthy lives are important. But we want a world where people living with sickle cell are living, they're thriving, they're able to achieve everything that they want to achieve. And I put a little reminder that we post on social media for people living with sickle cell to know that your life is valuable, your life is meaningful, you are worthy. Like, no matter the challenge, every one of us that is living with sickle cell knows that there will be times when you're super low and like no amount of comfort will make you feel better. But those times will pass, and everything you want to do is achievable. You know, we have musicians, we have rugby players, we have lawyers, we have doctors, we have artists. So everything we want to do is achievable. you're brave, you're powerful. It's okay to be in pain. It's okay for things to be tough sometimes, but you will overcome every single challenge that you see. Okay, thank you very much. I'll stop there and very while we go on to the next session. Thank you.
Thank you. I had to say amen as you were reading that last slide. Every single one was so rich and so inspirational. Thank you, Ms. Bukola. Your words were powerful and excellent, highly educational.
Thank you.
And we're going to, since you're going to be part of our panel, I want to save some of the questions because I wrote some notes down, and there's several questions related to the things that you addressed. So first, we're going to take a very short break, and we would like people to be back by 12:55. So that's like 5-minute break.
12:55. Let's take a break.
So 12:55, and then we'll resume. So if you need to get some beverage, if you need to, relieve yourself, just 5 minutes.
2 minutes.
2 minutes? Okay.
2 minutes, just to...
We've been told 2 minutes. So quick, get your beverage and get your ease yourself and be back and start.
Sorry, drop. Drop from 2, 3.
Hold on. The woman meeting channels complain, although it's visible. The audio from Sunday's laptop, you extended it, mic it's cracking. It was fine initially, but it started going cracking. So she's asking if audio you're going to give her eventually, how is the recorded one and it's not cracking?
The audio here is not cracking. Probably is network.
Is it Polly who will see what's
because in that general room, we extended the HDMI to the TV. Audio is cracking, but on my laptop is clear.
Let me just
asking.
Why need to come back for? If your laptop is clear, let's use the laptop to connect the screen.
Yeah, so it's 2 minutes already.
We're back.
We are back. Thank you. So welcome.
Thanks everybody for checking in.
Yes. So I would ask each of our panelists to start turning on their cameras as I introduce you. And tech team, when I say the person's name, please start adding their spotlight so we see them on the screen.
Yeah.
I want to start with a name that you've already heard multiple times today, Dame Edith Okoa. This woman is truly a champion And it was mentioned earlier that her foundation that she founded, the O5 Initiative, or O5 Foundation, they're actually here and we see them if they want to wave. We see them in the red. They look lovely. Hello to you all and welcome. And thank you for supporting your patroness. Dame Okoa is an educator. She has a history of teaching and state civil service. In fact, she retired as a permanent secretary. She's also a philanthropist and motivator. The things that she is passionate about are sickle cell disease and also helping those that are homeless. From the line aspect of sickle cell disease, when she was in the governor's house as the wife to the governor, she established 23 sickle cell clinics across Delta State and a sickle cell referral center that had well-equipped advanced technologies, including newborn screening and transcranial Doppler scanning. What I think she's most proud of course, is her marriage to the Senator Dr. Ifeanyi Arthur Okoa and their 4 children and several grandchildren. Welcome, Dame Okoa, and we're delighted to hear from you. I also would like to introduce our 2 of the speakers you've already heard from, Dr. Alayo Shofeka. Dr. Shofeka is the Deputy Director at the Federal Ministry of Health, Nigeria, and he's a goal-oriented professional. You already heard the strategies he outlined for the federal government related to sickle cell disease. And he has co-authored several guidelines and papers related to this. His portfolio includes other blood disorders, including hemophilia. And what we appreciate most about him is that he's an advocate for equity and inclusivity. So welcome, Dr. Shofeka. If the tech team can spotlight him as well. And we've also heard a little from Dr. Abosede Wellington. She is a public health physician, and as mentioned, she's the sickle cell disorder coordinator at the Lagos State Ministry of Health. She's has 2 decades of experience, and one of the things about her career is that she thinks about innovative solutions. She brings a fresh perspective to understanding how we can address challenges such as sickle cell disease. And in fact, she has a commitment to addressing the sickle cell disorder and controlling it in Lagos State. So we welcome her as well. And then Professor Adeyinka Falusi. Welcome. Professor Falusi is a retired professor of hematology, and she has an over 40-year career as a research scientist and a hematologist. She has over 150 publications and citations. Her work has garnered her the honor of being a visiting scientist in cities such as London, Berlin, Chicago, and she's also very well grant-funded during her career. One of the things I thought that was exciting about her is that she was the first chair of a functional institutional ethics review committee in Nigeria. And she produced the first ethics guideline. This is quite important when we talk about a disease such as sickle cell disease. She has several honors, and so numerous I can't count them. But she is a member of the Nigeria Academy of Science. She received the coveted L'Oreal UNESCO Laureate Africa Award, and she's one of 3 people to receive this award. And then after she retired, she was like, no, I'm still going to work. And she dedicated her service and life to sickle cell disease advocacy. She founded the Sickle Cell Hope Alive Foundation, and she's been working to reduce the burden of sickle cell disease in her respective area. And then last but not least, I want to introduce Mr. Lekon, whose full name is Olami Lekon Masood Al Khalifa, and his professional name is Lekon. And I'm sure all of you know him, a Nigerian rapper, singer, media personality. and he's currently the youth ambassador of Ogun State. And he's also been part of the Grammys Reporting Academy movie. One thing that you may have already heard is Sickle Cell Warrior, and he's an ambassador for the Sickle Cell Foundation Nigeria. He is a true advocate, a philanthropist, and he is about change and transformation. And then, this panel would not be complete without our chairman of the day. We would like to welcome Dr. Adekile. Please join us. And of course, we would love our hostess with the most, Dr. Annette, to please join us as well. And I think this will make us a very nice panel to address our questions today. And so if you can also add the remaining panelists, tech teams, that would be great.
Then the event for Unilab also.
Okay, we're still waiting for, I don't see everybody, and I would like Ms. Bukola to also be spotlighted as well.
Mr. What?
Alright, and I can do some of these. Let's see who's missing. And is everybody here? Where's Dr. Okay.
And Dr. Kwashikwe, I was asked for a moment. Did you get a link on?
Yes.
On the call?
Yes, he is here.
There he is.
Yes, and let me spotlight you as well. If you can turn on your camera, we'll spotlight you as well.
Dr. Kwashikwe. No, the con is there.
And Dr. Shofet Khan, if you can turn on your camera, that will allow us to spotlight you.
Thank you.
And then I think our panel will be complete.
Okay, so you may one person.
So when, okay, perfect.
You may not lie you.
So perfect, no?
No, you may one. Lie you as well now.
All right, here's our panel. As I mentioned earlier, we have over 60 questions that have come before the program and during the program. And these questions fall into 4 categories. One is the category of facts and myths, sickle cell disease, facts and myths. The second category is that of the person and society, sickle cell disease, the person who has it, and the society that they dwell in. The third category is on treatments, prevention, and screening. And then the last category is about our healthcare systems, both locally in the state and federally in the government. So let's first start with some of the facts and myths. Dr. Adekile and Ms. Bukola, both of you gave us a brief introduction to sickle cell disease. But Dr. Adekile, can you please just summarize briefly what is sickle cell disease? And tell us a little bit about some of the complications that a person may endure.
So thank you very much. I think as we all know, sickle cell is a genetic disease and is transmitted from parents to child. And to get the disease, you got to inherit 2 copies of the affected gene. If you inherit just one gene, then we say you are a carrier, or you have the trait. Now, what happens with sickle cell anemia or sickle cell disease is that the hemoglobin in your red blood cell, when it loses its oxygen that it carries, it forms a precipitate, and that kind of distorts the shape of the red cell and also affects the functioning of the cell. And the main problems that occur is that the cells become dense, they become sticky, and they stick to each other and to other blood elements and to the blood vessel lining. And that causes obstruction, or what we call occlusion, to the blood vessels, and that's what causes typical pain that we get. The second characteristic, of course, is that the lifespan of the red cell is much shorter. So instead of the 120 days, your cell lives for only like 15 to 30 days. Therefore, there's chronic anemia. Also, there is what we call inflammation that is triggered, and this affects all the vessels of the body. And because of that, there's no tissue or organ of the body that is completely spared. But the main areas that problems arise are the spleen, especially in young children, and that's what predisposes children to a lot of bacterial infections. And then we have, the pain that occurs in the different bones and other parts of the body. So the bone in particular can be affected by infection, by what we call necrosis or death of the bone, and that's why sickle cell patients tend to have problems with their hip joints and maybe even the shoulder joints. Okay, and then of course the lungs, stroke, ulcers, priapism, which is painful sustained erection in males. So those are the common kind of problems that occur. But the main cause of death in children is usually the infections. And in our environment, malaria contributes a lot to all the problems. So in brief, those are the kind of problems that are associated with sickle cell disease.
Thank you so much. That was wonderful. And there's a few points that you made that address some of the myths that we received, or the questions about sickle cell disease. One of the questions was that, is sickle cell disease contagious? Is it infectious? Because you said something about infections, and people are wondering. You said something about inheritance as well. So is it contagious? Like if I sit by somebody with sickle cell, will it come?
Well, thank you. Let's clarify that. Sickle cell disease is a genetic disease, that is, it's inherited. It is not infectious. You can't, get it by association. Okay, you got to have it by inheritance. It's only that the disease affects your immune system, especially the spleen. The spleen is so important in children in filtering the blood of bacteria and other things. And so when there's a problem in the spleen function and other aspects of the immune system, that's what predisposes patients to infections, especially in childhood. And that's why we advocate penicillin prophylaxis and immunizations.
Thank you. Professor Falusi, I wanted to know, can you tell us more about this concept of genotype and also inheritance? One specific question asks, if I'm AS and my partner is AS, how does sickle cell, what is our risk percentage? And then if you're able to, or if another speaker wants to add on, what's SC, what is the C, what is the D, what is the S, why are all these other letters associated with sickle cell disease? So please shed some light on those issues. Okay, please unmute. Okay, there we go. Yes, we can hear you now.
Okay, thank you very much. So, in the inheritance, you find that, as Professor Adekile explained before, it can only come from father and mother. And each gene that you carry, each trait that you carry, a trait is a character that's shown in you, whether the color of your eyes, or the makeup of your blood, or the makeup of your tissues. Everything is inherited in doubles. So one comes from the father, one comes from the mother. So when you inherit this sickle cell disease, you have one S from the father, one S from the mother. And when it's the other way around, then you have A and S. So these are basic ones that people have. But one thing that people never get right in this country is this 1 in 4. 1 in 4. It's giving a lot of people misconceptions. They don't understand. Even the scientists, once they read biology and just go away and they say, 1 in 4. And people tend to get this right. They're wrong. Believing that if you are AS and you are married to an AS, that you are bound to have an SS.
Am I the only one?
You are bound to have one AA. You are bound to have 2 ASs. It is not so. The genetics has no memory. It is combining at random. So if the A continues to combine in the father and the mother, you continue to have these children that will come out as AA, even when AS marries AS. Sometimes the S chooses to combine all through. Like we had somebody in the hall yesterday. Yesterday was Sickle Cell by Life Foundation celebrating World Food Fair Day. It was over 1,000 people in the hall. It was beautiful. 500 patients with school children, with adult thousands. And we were explaining all this. What happens is that when you have, there was a man there who kept shouting because we had a panel and they said, okay, they couldn't hear him anymore because the time was going off. So he kept saying, I have to say my own. And in that process, he told us he has 7 children. 6 of them are SS.
Have you seen the person?
And the guy kept shouting, said 4 were dead. And 2 were living. So what happens is that people get it wrong. It is not always SS combining. It is not AA combining. It is at random. So you may have just one SS. You may not even have any, but you may have all of them as SS. And 1 in 4 means simply in population genetics that if you take a whole city of AS, take another large number of AS, marry them together, in the next 20 years, count all the children they would have, you will find that about 1/4 was AA, about 1/4 would be SS, and about 50% would be AS. It's just a population genetics. It's not per family. And we've got to get down to our people, because all will have one child, they say, oh, I'm still waiting for SS. They get so stressed, waiting that an SS is coming. So when they have only 2, they will say, oh, maybe the next one is SS. So this is a lot of anxiety for them. We've got to allay their fears that it's only God that determines what's coming next. And it may not even come. It may come. So, and then some of them, they have 1 SS. They say, oh, thank God, I can now have 5. Because no SS is coming again. But it is wrong. The next 3 SS is all determined by God. It's not we who put it there. It's not the doctors. It is random combination. The genes have no memory. They don't say because yesterday I came to Shokweko's house, I am not going there today. No, it doesn't say because you are a millionaire, I will not come near your house, or because you are a musician, I like you so much, I'm going to be coming to your house. It goes at random and combines and gives whatever it comes out. Or we can do something, maybe by genetic engineering, or maybe by bone marrow transplantation. But before then, it is at random, and that is the combination. Now, as to the percentage of A and S, yes, it is a 40-60. It can be A 60% to 80% in an AS. 60 to 80 can be A, and the remaining 40 to 20 can be S. So you always have this S in a larger proportion, and it is protective to the S gene in that combination. But one thing that people miss is there's a lot of misdiagnosis. People go to a laboratory that is not specified for this referral, and then they do
you don't need to remove them.
That they've been washing the paper sometimes, and they've been carrying one blood to another, and there is a transmission of this, and the bands are not coming out well. And then somebody has an S-beta thalassemia. When you have S-beta thalassemia on a routine acetate, cellulose acetate, you're going to get an S-band, and you're going to get a little bit of A. But people don't understand. They just see these 2 bands and they say this is AS. And this is wrong, because you have to quantify how much A is there, how much S is there. When the A is much more than the S, that is usually an AS. Although it's not confirmatory, that is crazy.
Let us take that as another session, because regulation on laboratory is a lot.
Okay, so it's 60 to 80. Now when it comes to what is SD? SD.
Am I? Yes, unmuted. So this is to Professor Titi Lokwe. To please direct questions to Lekon now, because he has a short, limited time with us.
Oh, okay. So Professor Falusi, we'll come back to some of those points, but let's move. Most of my questions for Mr. Lekon were about the person and society. And maybe can still add to that.
Now redirect his question.
Yeah, is he able to show it? Sir, Mr. Lekon? Okay, there we go.
Yes.
Good afternoon, everybody. Thank you.
Good afternoon. Yeah, thank you for joining us.
What did you say? So much.
Oh,
I didn't have very much hair.
It's release period, so everything is ready on
Okay, so Mr. Tell us, what does the sickler label mean? Do they call sickler because it means people are sick? And why do you refer to yourself? It seems as if you don't use the sickler label. Tell us more about how you refer to yourself. How do you see yourself as an individual living with sickle cell disease?
Okay, for you to understand my perception of myself and of the sickle cell disease that I'm living with, I think I have to do a backstory of myself growing up. So I didn't even know I was sickle cell until 2012. Yes, I didn't know I was sickle cell until I got admission into the University of Lagos and I did my medicals. So that was when I went to see doctors about it, and they gave me drugs. I haven't used the drugs. I didn't use the drugs because in my mind, it's like, if I start using them now, maybe whatever it was that I wasn't feeling before, I'll start feeling them now. So I didn't use the drugs. But growing up, I knew I was different. I mean, I didn't walk early. I was really tiny. And that was when I kind of like made a conscious decision that if I'm not able to meet up to my mates physically, then I have to be able to surpass them mentally. Hence, I started working on myself mentally. So I paid more attention to how can I, or if they say don't come and play football with us because you are tiny or because you get hurt easily or because you fall ill so much, then it's like, okay, by myself, how can I improve myself and make myself valuable with my intelligence or with my brain or with my mind? Because whatever is happening to me is happening to only my physical body and not my mind. So how can I improve my mind and work on my mind to get better? And when I became a public figure, or as I was growing up, I started learning more about it, when I got into NYSC camp and they saw my medical records and they were like, I have to go back home. I said, no, I'm not going. I want to stay. I want to experience whatever it is I'm supposed to experience. I will be fine. Because eventually, for me, it's my mind. Like everything else stems from my mind. So how people perceive me is really little or doesn't really affect me as much as how I perceive myself. I don't think anybody wants me to succeed like I want myself to succeed. I don't think anybody wants me to get better like I want myself to get better. I don't think anybody wants me to grow as much as I want myself to grow. So criticisms or whatever it is people say based off of what they think I am because of my sickle cell disease, for me it has never affected how I live my life or what I want to do for myself, because I still do believe that if you want to do something, regardless of how long it takes, regardless of the situation around you, you can get it done. It's your mind. I mean, the adversities will come. Life will do what it is supposed to do, which is to bring obstacles in front of whatever it is you want to do. But you now have to do what life expects you to do, which is fight and push through it. That's how I've always lived my life, basically. So it's kind of like stems into everything else that goes on around me, including my health.
That is so well put and very inspirational. In fact, can you share a little bit more? You mentioned being small and being told you're not going to fit in. There's a question that came about body shaming. That, people don't feel beautiful. They feel like they're ugly. They feel like they're too small. They're too this. How do we deal with that stigma and self-image? You seem so confident, and as Dr. Annette was admiring your hair, you're clearly a very handsome individual. So how do you deal with that self-image component, and what would you say to encourage people who are struggling with how the society?
First off, thank you for the compliment. I appreciate it. So, like I said, when I was growing up, because I think I was born in the 90s, so my parents I mean, they had secondary school education, not to the point of university education. So for them, it wasn't a thing of, oh, it's sickle cell, is why his growth is a bit stunted, or he isn't growing as much as fast as his peers or everything. So I didn't know, they didn't know, which meant they didn't see it as some sort of, first off, their ignorance helped in a way, because they didn't know I was sickle cell, they didn't place any barrier on me. Like they didn't say, oh, you can't go and play here, you can't do this, you can't do that. So I was allowed to do everything that every other kid could do. It was just I physically could not do it. So it wasn't like a mental, oh, you can't do that because of your health, or you can't do that because of your health. So for me, it was a physical thing. And then eventually I just really figured out that, oh, if I can't do it physically, at least I can do something that was inside this my mind, using this my mind. I mean, so for me, to them, it's a normal thing that you see around kids. If I'm not going to play football well, then the team will not choose me because I'm going to allow them to. So that's just common sense. They need to pick the player that would help them play well. I mean, then I would feel some type of way until I started cultivating my mind to understand the perspective of them and where I need to put myself. It never really stopped affecting me, and that's why I'm still saying that for the public figure that I am, and the fact that I face a lot of criticisms for anything that I try to do that is outside the norm or outside where people's mind can comprehend. I tend to understand that last year, because first off, living with sickle cell means you're different. Being different means your path is not the same path that everybody is going to take, which means, first off, your upbringing, your mindset, your health is different from everybody else's, and which means they would rarely understand you. Which is why I feel like the sickle cell community needs to be more vocal, both offline and online. Like there needs to be a community where people will be like, oh, okay, yeah, I have people that have my back here. I have people that can understand what I'm doing here. So for me, it has always been in my mind. Like I live in my head a lot. Because that's where I find strength. When I am weak, that's where I can console myself. That's where I find the energy to come back and try.
This is your Baba where they come collect video for our office.
So I really don't.
This guy, social media guy, he gave me their address yesterday. Can he stop around to help me to collect it?
What can your mind use to replace your physical actions? How can you do something with your mind?
No, me I did loot.
That's where your strength is. I think as a physical warrior, your strength lies in your mind. Because if the body is telling you don't do this, then what can your mind do?
Waiting you body from us to where I did.
Is an
I
example.
did Jaraba here now for
He was on the wheelchair, but the things he achieved.
I go reason about give him something to just help me collect the address.
That is what life has dealt us. The cards that life has dealt us is your body is not good. You are not
thinking dogs call me.
And then again, there are a lot of
like this Sickle Cell Foundation, where they opposite to you.
But you feel like your body has been taken to not be able to use you have your mind. That means half of the energy that your body is not able to use, your mind has them. You just need to access them and start using your mind.
That was well put and such an inspiration. The chat is just flooded with claps and cheers, just recognizing what you said about that mental strength. I don't know. It seems like you have to go. You have to go. A little bit. Okay. Yeah, because there's just so many things that you alluded to, but I don't want to. If you do need to leave early, we understand. And when you're reading, I'm curious. Okay, we'll keep that in mind.
Access to your WhatsApp, there are many messages or questions coming to
yes, I have seen those ones as well.
Honestly,
I decided to go ahead to one of the big ones. There's a big one that I think any of you can address this debate about should you ban marriage between AS and AS, or any phenotype, AS, all of them. That's one of the biggest questions that has come from today's chat as well. I think it's complicated. And Dr. Stropekan, I think you emphasized something. You emphasized education early, but I'm curious about your perspective from the Ministry of Health side. How would you address calls for policies related to restricting marriages?
Policies and laws.
And laws, yes.
Yeah, thank you. I think, like you rightly said, it's very complicated. For us at national level, it's something that is very difficult. It's something that cannot be done, even when such a bill was proposed at the National Assembly. Of course, it was struck down because it will infringe on the rights of these people, right to free association. You cannot also, in fact, you are going to see a flurry of cases. People challenging that, going to court and all that. And then it means that we have also violated our constitution. So as such, it's something that we are handicapped. Nobody can even. As a matter of fact, for me, as the focal person, national focal person for sickle cell disease, I don't advocate for that, but the thing is that we need to give people all the information they need. Let them take firm position on their own. Let them know what they are going into, and then, like I always said, science has also provided some leeway for those who want to choose to go that route. Of course, there are a lot of things that to be done. There are a lot of interventions that are available now. So, but that does not mean that we should encourage them. We should let them know what they are willing to face. And then, yes, people say love is blind, but I don't think so. But it's something that's very, very complicated. It's something that we cannot begin to talk about. What will happen. So for us at national level and in Nigeria, making sure people get the help they need. And it's support, really support the educational, the information that they needed. That is very paramount. And that is why we need to take these messages to every understanding of our country. And also, if you look at it, we also have some culture in our country also, where you have married by consanguinity and all those things. We have it here. It is practiced in some parts of our country. So, it's not something that you can just come up and stop by law or anything. It's something that we needed to let people see the disadvantages or disadvantages that are associated with that are quite checking compared to the advantage that you think that with the right of relationships. So these are the issues.
You just three of them that are on.
And like I said, it is very complicated, and it's something that people have tried. They brought up a bill, in fact, not once, not twice, but of course, it has been struck down. So definitely.
Thank you for the line. Sorry, I'm doing that because of time. It's emphasis on education and early. It's like programs that are initiatives is catching them young. That is give us reading, for instance. You said that in your remarks, but also. School, secondary school, every opportunity, and even at youth corps camps, at the NYC camps, information and testing. So the HIV and AIDS program, where they do education and testing, That sort of thing we can find out to be sure.
Exactly.
And we want to teach them time. You said so. You said it all. Thank you. I'm promoting it.
That is, thank you so much. And both of you talked about screening. Dr. Adekele, can you tell us more about prenatal versus newborn screening? Several people want to know, can I know before I get pregnant, or can I know while I'm pregnant, before the baby comes? There were several questions about screening.
Great. I think the question of the early diagnosis is so important, because that's one intervention that has been proven to affect the eventual outcome in terms of the quality of life, survival, and all that. And so the earlier time, the recommendation, of course, is that all newborns should be screened. And I know that in the US there's a law that mandates it, and in other places too. But the problem, of course, in Africa or developing world is that when the facilities, one, are not available, readily available. Second is that not all births take place in the hospital. Okay, so the trend is that at them when you can, and the immunization period is one time that people target to do screening. Yes, you can do prenatal diagnosis. There are several techniques that are available. Amniocentesis, coronic sampling. Okay. Now again, it's kind of invasive, and the expertise is not readily available in most places, but it is possible. What is even more possible, more exciting, is that you can do pre-implantation diagnosis. That is, if you get pregnant, you have to do in vitro fertilization. Then you take the good embryo, you take one of the blossomers, and you can do phenotyping people at that point, so that you now implant a normal embryo. Okay, and why that is important is that in places like where religion plays a big role, where abortion is not allowed, so that if you do a prenatal diagnosis, what do you do with the information? So in those places, they would rather do pre-implant diagnosis, and that is acceptable.
Thank you. Dame Okoa, I was.
The church. They will take medications, many complaints around that. So let's just put that down there.
Okay, and I was going to ask Dame Okoa a question, but maybe she had to step away. So let me go to Dr. Wellington. Based on the discussion on screening, can you tell us more about Lagos State initiatives regarding screening? And then Dame Okoa, we would love to hear your perspective about Delta State as well.
So if Lagos State, any restriction laws in Lagos State or marriage?
Good afternoon once again, and thanks very much for this opportunity. We do not have any restrictions on marriage for sickle cell carriers in Lagos State, and we do not intend to. I keep saying, people forget that we do not need to get married to have children. So, you don't need them all the necessary. They can make their informed decision. A child that knows that, oh, my genotype is from primary school, knows it throughout secondary school, throughout university, and knows the implication of what genotype is. Not being discriminatory, but making informed decision when it's getting a life partner on time and have children. So we do not have to, do not expect the outside they're not going to work, there's no point to visit our area. But newborn screen, which is the one that we know will work. I mean, in Lagos State, we discovered that all over the globe, we don't only have children with sickle cell, only in Nigeria or Africa, but they're all over the globe. And discovered that a lot of them do very well outside of Nigeria, outside of Africa. Why? So that, of course, when you catch them early, you start managing them early. People can come out very well. They come out very well. You monitor them to get them all the things you're going to get them, all the medications, all the vaccinations, as and when They do very well. They have fantastic outcomes, which was why we started newborn screening in Lagos. We started in the year 2020, but because of COVID thing that shut down the world, we had to delay a bit, and then we couldn't really implement across the field. By 2021 January, we had full implementation across 65 health facilities in the state, including general hospitals and primary health care centers, where we screen for free. We do not charge for it. But we do not screen every baby. We only screen at-risk babies, because the child wants to use the little resources that we have. So we only screen babies that the mothers are either carriers or have sickle cell. So if the mother is AA, we do not even bother about the genotype of the father. Once the mother is a carrier and has sickle cell, we screen that baby once a week. And just like Professor Adikile said again, another opportunity that we use besides when the mother deliver is also during immunization. And like you rightly said, we understand the fact and we know for a fact that over 60% of the babies born in Lagos are born in private facilities, in TBA, definitely outside of the health facilities that we have. But we don't take it for a fact. But for a fact, it's come back with immunization. When it's time for immunization, we bring these babies. So during immunization, we also we extend our newborn screening up to 14 weeks of age, as much as possible before they can have the opportunity of having the first prize. So we at least we also match it to when you come for their immunization. So from 0 to 14 weeks of age, we screen the babies. And then once we screen anyone who have sickle cell, we refer them immediately to sickle cell clinics and state, and then follow up from there on. So earlier on, the mothers, the fathers, the carers, they knew what they're doing. And they're not just alone. I mean, the usual story we have is, oh, this child has to go back treating malaria, and then all of a sudden, this child gets paid. What is happening? Somebody then says, you know what, why don't we just take it time and then go and do the child has sickle cell. We want to change that story. We don't want to hear that kind of story anymore. We want to catch this baby young, so that from birth, they are already pushed to. When you need to get their diarrhea, when you need to get all their vaccines on time, you get it, and then you fine. That's what we're doing. And of course, we're supporting with other things like sickle cell clinics. We're trying to improve the capacity of our healthcare personnel that we have, so that we know that we do not have enough, and even the people we have, they are JAPI. Every day, they are JAPI. So we build capacity, and then we do taxation and tax sharing, so that even whoever is on ground, a child that has sickle comes into your facility, even if what you can do is like first thing, stabilize that child before you can now refer to a reference center. That goes a long way, because we know once you have a child with a crisis, that child is a tricky time bomb. It is a tricky time. You need to provide an intervention and speak with Dr. Wellington. So what we try and do, like I said,
it's just so impressive that
capacity across the facilities, train our, not just the doctors, even the nurses, even the health, the lab scientists, to be able to provide whatever kind of support that is needed for us to take care of these children that have sickle. And of course, that's somehow translating to the management of the adults. But we have a lot of focus on the children, because we know that once they survive that, they do well into adults. It becomes a life, it becomes part of them. And like in a context too. Another thing we're trying to look at is this. It's a major thing, which we don't know. Genetic cancer. And that's because we do not have enough personnel, but we need to do this. And then we're looking at how we want to put up our leaders. We're going to be able to get some sort of support in that aspect, so we can train genetic cancer and be able to provide this services. Yes, we know that we have a lot of cases. We don't have enough healthcare providers, but we know that every opportunity you have to come in contact with someone that has sickle cell, whatever information, correct, precise, appropriate, adequate information you give that person, it goes a long way. Because you do not want them to get the wrong information, you give them the right information. And another thing I would want to add is what they call and said about this is my own thing. It is great. It really is the truth. It is great. I mean, mind over body, mind over body, spiritual over physical. It goes a long way.
And you know, Dr. Wellington, I want us to really dive into. So before we dive into that one, I would like to also hear from Dame Makoa to counterpoint what you're doing in Lagos, which is quite impressive. And I was born in Lagos myself. I'm but I was born in Lagos, and I was born in the time when there was no septic. So I'm just so excited that the winds of change have come. What you've done in Delta State is amazing. Tell us more about the clinics and what the high needs that you noticed and the things that you're doing there that you established during the time of the governorship.
Good afternoon, everybody.
Question that came to me for Dame Makoa.
Oh, yes, please.
Dame Makoa, can you do what you did for Delta State for the whole of Nigeria?
I want to share video.
Can Dame Makoa do this in the whole of Nigeria?
With God, all things are possible.
Amen.
Amen. Changing the world one person at a time. So we start with Delta State. Yes. And concerning the newborn screening, I really want to thank God for this generation we are in. During our time, there was nothing like newborn screening. So people went into marriages blind, not knowing their phenotype. But right now, people are opportune to have such equipment. Why is the state of Delta State? I led advocacy and to ensure that the Sickle Cell Bill was passed into law and accepted by Governor, my husband, who was Governor of Delta State. This bill made it compulsory that every newborn child must be screened. And to that effect, we have a referral center where we have an equipment that is able to test every day the variant newborn screening machine, which has screened over 4,000 newborn children around Delta State. I want to also acknowledge the fact that even our neighboring states come to our facilities to make use of the newborn screening. Even after government, after left as first lady, had donated a couple of new variant screening machines to 9 hospitals. And I believe that they've been using such machines to be screening newborn babies because of I'm sure we'll be able to get
so what about sufferers who are not able to die? How will they understand this
who are
locked away, right? Locked away to die.
Okay.
How will you understand this grammar? They say the body of the person is too heavy. Sometimes I feel like ending my life. We stop the grammar and rescue my life.
So that has been
I hope someone is there. Okay, anyone? Yeah, I'm sensing it.
How much children that
they need to get all those feedback.
That are born sicklers in Delta.
I used to have.
Also, we talk about other things that we do.
When more graphics, this guy know graphics, know anything about graphics, anything about computer. He was working with me. In fact, I had to bring him to my office. Graphics to everything. The month he clocked 30 years when he died. In fact, we're praying that he should just surpass, because I heard that once they surpass that age, and they are saved. But one thing about this guy is, in fact, I wouldn't say he killed himself. This guy will always drug himself. A lot of time I will monitor him, I will do everything.
And that is not just
this guy
for this 2000. 24.
This guy breathes. Yeah.
Something that we're doing as long as
we're working together in neat way.
Amen. Thank you so much, Benokoa. You know, both you and Dr. Wellington addressed the initiatives to drive education and for improving lives of children, and just the work is quite impressive and inspirational, and I hope other states will follow your model. I wanted to talk about the other side of it, life. There were several questions about life. Mr. Nicola mentioned that one question that we got was, and people were putting ages like, I'm going to die 18, 21. You know, when I was young, I read in a book that it's 18. So after my 18th birthday, I just kept on counting. I was just like waiting. When am I going to drop it? When, you know. So, I don't know. Mr. Mark, can you start with that part? Okay. Do you want to add? I can't hear you. Oh, you can't hear you.
Yes, sir. We're almost rounding up, sir. I think rounding the round up.
And yes, please let our tech team know if you're still having trouble. So, Ms. Bukola, can you talk a little bit more about that?
Maybe opposite to Luke, Sickle Cell Foundation. Sickle Cell Foundation.
In my 40th decade, I was inspired when we talked about the Mama that was 91. Oh my goodness. You know, so 94. Okay, 94. So why is there this variability, and is there really a day that somebody will die with sickle cell?
Yeah, you know what's so funny is that I read that thing. Sorry, go ahead, Nicola. Okay, so I said I read that same thing, and I had that same issue, right? My understanding of it, I think what the book was trying to say was that life expectancy around that time, to the early 90s, was around 18 years old. I read it as well. By 18, we were not going to live past 18. And I remember thinking, like, okay, I need to do so many things, you know, before then I need to achieve so many things. And so when I crossed my 18th birthday, my next milestone was 30, right? So I have enough time to achieve all these things I want to achieve and do as much as I want to do. And I don't know, I think maybe, you know, like I said in the beginning of my presentation, that sickle cell was seen as a pediatric disease, right? A lot of people who had sickle cell at the time when they died, children, statistics around people who died before their fifth. And so, because we weren't seeing a lot of people with sickle cell, at that time, it felt like there was this clock, you know, that allowed your life expectancy. And so meeting this way, like I said, was really inspirational for me, because sometimes you hear about people living sickle cell as well past their 60s in the US and so on. So it feels like, well, they have great healthcare over there, or they have access to more things than we do in Nigeria. But meeting someone who has lived most of her life in Nigeria and has lived that long, and she was well, like she was able to. She actually spoke a lot when we got to meet her. It was really, really inspirational. I remember seeing Sickle Cell Foundation that had the cover. That was the first time I can't see any. And I was really, really
but we are listening now.
I'm excited to meet her. So I think that kind of misconception is what we are hoping that a lot more messages is going to share.
Except if I mute everybody, they now started muting themselves. They
provide hope, especially to parents. I think even if while we have that fear, parents have more
maybe when they
fear, right? Because they have this thing where I don't want to
I will have done that when we went for that.
Lose my child, sickle cell, and if you're reading all this information around, you know, infant mortality and people dying at a very young age, it creates a fear which I think put the fear that parents have, they put it onto their child, right? I like what Lincoln said earlier about sometimes ignorance is bliss. Ignorance isn't bliss with sickle cell, obviously, because the earlier you are diagnosed, the earlier you can have more interventions to improve your health. But I think for parents, it's very important not to place limitations on your children out of your own fear. I was really lucky that God saved my parents. They never stopped me from doing anything. They let me try everything. Obviously, they had the fear, they were scared, but they never said, don't do this because you have sickle cell, or you cannot do this because you have sickle cell. Every possibility was open to me, and I urge all parents who are raising children, or family members, caregivers who are raising children with sickle cell,
You can close any video that is not okay. Which one? You can stop any video
that was well said. And Mr. Lekna, if you can come back briefly, I know it's almost time to leave. I wanted to know from your perspective, this panel, we're not going to be able to give medical advice. There's so many questions about very specific medical advice. I want to refer you to the foundation and to your own doctor to have some of those discussions. But do want to know, is there something you're doing that is making you healthier? Like, are you taking a special diet? Are you doing special exercise? Tell us more about what it is helping with sickle cell for you, and then maybe if you like, you can also supplement from your own perspective.
Yeah, definitely. I work out every week. I think I only do work out every week. I work out every week. Regardless of I make sure that I take supplements.
I would have said at least we had about close to 500.
So for me, it's really what the doctor says, because I also do go for checkup at least once a
so many videos.
So there's always that.
You don't need to stop them.
Even before long distance trips, I go for checkup.
Yes.
So that's basically what I do.
The only people can stop is anybody that
I rarely fall sick because I'm always trying to make sure that I don't overwork myself. I don't do a lot of things that will make me stressed. Also, that's basically what I do. And also the dieting, I watch what I eat and all.
And then just in case of time when you have to step away, is there anything, because people are excited, they saw your camera.
It's not exactly. What do you eat or what do you not eat?
Obviously, I eat lots of protein because I'm trying to have a
lot of
I eat lots of protein. Every time I eat my breakfast, I don't really like eating naturally, but I did this for the past 3 months. I've been home. I make sure that I have my breakfast after working. I have my breakfast. I've taken lots of vitamins. Fruits also help make smoothies, to take smoothies, fruits and vegetables. Make sure that I have lots of that. And I don't really like junk food like that. But sometimes I take ice cream, pizza, eat burger.
In moderation.
Yes, definitely.
Just for everybody,
Yeah.
For everybody. So, and
like I said,
Bukola's book about nutrition and diet, remember? And the idea of colors on your plates. Colors on your plates, and just be sure that you're eating well, and then things, and then to reduce inflammation. No soda. You believe without soda, that is what we call minerals, the soft drinks. We can drink, we need water, we need fluids, but not those they increase inflammation, and that makes us ill, make you all the prices you want to invest. So if you're listening and participants, avoid soda, go buy the minerals on the road and buy water.
Drink lots of water.
Thank you.
Yes. I wanted one final question for you because I know you may have to leave soon. What would you like to, last word from your perspective, to tell those listening today? Several people were excited to see you on. Maybe this is the first time they're hearing that you have sickle cell disease, and yet you're having this life. you see yourself as having a life beyond your disease. What are some things you would like to share with us before you have to step away?
I mean, the most important thing what I've realized as few weeks concerning this life as a whole is what matters is what you do in the world before you leave the world. And as such, the position that we're all in is for a reason. The world needs us to do something, is why we've been placed in that position with those circumstances, with those obstacles, and the chances that we have. It's for the world. It's really, in the grand scheme of things, we are just passing by. Because whatever we need is what they will use eventually. We have gotten to this point based on what we have left behind now is things that the next set of people that will come into the world. Hence, that's why those days were not limited. If you leave this world today, a lot of things will not happen. Because a lot of things that supposed to happen are tied to whosoever you are. Right. It may seem like, oh yeah, every hard, it's complicated, it's tough, how am I going to get it? You will. Because eventually, a lot of things that are meant to change the world are tied to you listening to me right now. So to find ways to make sure to improve yourself and grow and push through it. It's very important. I don't think sickle cell is going to stop you from becoming who you want to become. It's just what you are able to overcome and change the world for everyone. That's what I have to say.
Amen. Thank you so much for joining us. And I was told our panel is running out of time, so I want to now go in order of each panelist and have you say also a final word. And Dr. Annette, I'd like you to also discuss transplant a little bit more in your closing remarks if possible. So let me start with Dame Akoa. Is there anything you want to leave with the viewership today to inspire them, encourage them, or call to action? Okay, there we go.
Yes. So I asked if there's any encouragement I can give my warriors.
Yes.
His final words. I will say, just like Lego has said, that life that they have come and that everyone has been created for something. No one is an accident. And one thing I tell my warriors is that it's not
I will know one day I'll buy background voice. You see background voice can come.
Warriors that have made it in life.
That means no, I'm a panelist.
The warrior that is the judge of the high court.
You see no that person too.
Most times when I go out, I take her to encourage them to testify how to live her life. I encourage warriors to eat well. Their lifestyle must be right. Like Leko was talking about water. Water is very good. If you have to take anything like a drink, you can take your fruit and juice your fruit instead of having to take Coke and Fanta that is saturated with sugar. Take a lot of rest. Heal your body. You must even do what others are doing. If you're tired, learn to rest. And I believe, as a teacher, I'm a school teacher, I've seen warriors that are very intelligent. I've not taught any warrior that is dumb. I encourage them that they can make the best they can have in life. I also encourage parents, don't look down on any child. We see those that are not SS that are dying. Bicyclers are alive. So, everything is in the hands of God. In that state, when you do a political surgery, there is a woman that is 65 or so, 65 years of age, a retired nurse, living very well and you will not even know that she's a warrior. Don't look down on any man or any woman. Don't look down on any child that will tell you because you never can know who is going to be that will be the one that will take care of you.
Thank you, Dr. Makoa. That was beautiful. Professor Fawzi, any last remaining words? And because of time, I would ask our panelists to be brief, but thank you so much.
Well, when we talk about sickle cell disease, it is a family of diseases. So don't let us assume everybody's SS and frank SS. There are ones that come almost every week to the hospital. It's not a death sentence, but like facing a lot of challenges. We see a lot of them in the community. There are all those that have other factors in the genetic spectrum, like S-beta is the most ordinary places they will call them SS. And then come with a little bit of anti-health. There is those who have SS with F, high F. One was speaking to me this morning from Lagos State. She has very high levels of F. And this fetal hemoglobin has a lot to do in the pathophysiology of this disease. So everybody is not just one type of SS. So let us know exactly what we are. And let us work towards making sure that others know their correct treatment. And they also listen to their body as it said. The environment is another thing. You can't leave the genes alone and not work on the environment. If somebody lives in a place where there is a bottle of water all the time and there is malaria parasites all the time, then falciparum will eat all the blood and it will be very low. And that person goes to the hospital every day. So the environment and the genetic aspect and the understanding and the education of the parents will make a sickle cell person, a person with sickle cell, a better person than somebody who is extremely ignorant and is not doing anything about the environment, doesn't do anything about the genetics. It's going to be hard for them to cope. So let us know that these factors are all important in playing out and giving us a good life for people living with sickle cell disease.
Well put. Well put. Thank you, Professor Fawzi. Dr. Wellington.
Yeah, thank you. I'd like to thank all the other panelists and speakers. I just want to say that each and every one of us, we do have a role to play in this fight on sickle cell, and I just want to encourage everybody to more than their best to play their role. Be it the clinician, be it the champion, be it the warrior, be it the policy maker, be it the pharmaceutical, be it the NGO, whatever role it is when you find yourself in this fight. Let's give it our best. We all know each other. You don't have to only be the one, you don't need to be encouraged and everybody, but we all know each other, because if you have a sickle cell warrior in your family, it affects the whole family, it affects the whole community, it affects everybody. So let's all play our role. Thank you.
Thank you, Dr. Wellington. Beautiful. Very, very encouraging indeed. We are not an island. We should be a community. Dr. Shafik, when you give your comments, because I have persistent requests about this, I don't know if you can share anything about blood transfusions and the scope of how we can help Nigeria, and then any parting words from your viewpoint as well. And sir, please unmute.
Yes, thank you. Quickly, remember we have a Nigerian blood transfusion services. They have offices across the country. So I will encourage people to donate so that we have sickle cell people living with sickle cell disease who requires blood so that they can actually get blood. And because we've been doing that, there's been a lot of campaign across the country. People need to donate blood. So that is there. So they are available across the country in all the 36 states of the Federation and FCT. Yeah, as for the parting words now, well, I will stay on those living with sickle cell in our country. Always remember, this is the epicenter of sickle cell disease. They need to come forward. They need to speak up. Presently, of course, it's like you're having a staccato of all sorts of words here and there. They need to come together. This is what I've said. And with that, that is the only way they can have a voice. That is the only way they can influence some of the decisions that government are taking. And that is the only way they can actually draw attention to ourselves
as people living with sickle cell disease in Nigeria. And I'm here to actually support that. I'm here to push whatever agenda they have forward. I'm here to support them. So they need to come out of the shadow of sickle cell disease. So I think that is my parting word for them. Otherwise, every other thing that other panelists have said are okay. There are things that that we need to work with, but above all, they need to come out of their shell. That is very key. Thank you so much.
Thank you, Dr.
Thank you.
Yeah, I also like what you said earlier. You said come out from the shadows. And shadow, it brings that word of shame. Shadows means despair. Shadows means fear. Come out from the fear, despair, and the shadow. The well put.
Yeah, and that is one of the best way we can address stigmatization in this country. Thank you.
And Dr. Annette, I know you're our host for the day, but do you have some words to share? And maybe tell us a little bit about the Foundation's work with transplants. I think a lot of people had questions about that. They had a question about transplants, and I don't know if you want to share what the Foundation is doing.
Yeah, I will. But I want to just thank all other panelists. This has been wonderful. There's so much to talk about, and time is always a problem. But again, this is just the tip of the iceberg. It's left to us to now go after this meeting to do a lot more interaction, engagement, reading, talking to one another. The same thing with all participants. What you've learned or gained from this session is for you to now share everywhere you go. Okay, I will just start my remarks by just pointing out, reiterating that sickle cell is not a death sentence. True, but it is not a stroll in the park. It is not easy to do. You need to really work. You need to take care of yourself honestly. And then, anyone who has sickle cell can live long, productive lives. As long as they're properly managed and they can contribute meaningfully. Look at all of us here to the community. So let's just put that there. So the culture that I touched on that very little because I'm saying very little because if you look at the pyramid of care as a public health consultant, I always look at the base of the pyramid. That base of the pyramid of care is when it's comprehensive. So all our routine medication, all our newer medicines, hydroxyurea, the newer ones, also brighter. You can let them be cheaper. Okay, Nigeria is the highest burden of sickle cell in the world. We should have facilities for once and again transplantation stem cell. So it's there are very few people in terms of affordability, but also in terms of what is the candidates.
Right now, I'm sure automatically I call click. No, we don't show video as a different show like that. It's click about it. Last month we watched it like we were. No show. Oh, yeah, no show video. Yeah, don't show live. Okay, so like then I'll be live there. So if you like the show, because I'm only picture. Effectively, scripture. Go at the image, both middle screen and whatever that is happening. Just by my boss. So she can go wherever it's the
look at all the questions that came in around I don't like that. I don't like to see those questions like that. Because
my coffee came in there. Way back now.
It's not all too much blue. Let's emphasize that. There's light and I think the chairman said that. And I must emphasize. And there are so many advances. And then there are other things that are not good medication.
Anyway, I'm more directing back drive.
Arts in medicine. We're pioneering that. So people are finding out that they have other talents and they're finding new purposes to their lives. And then it's exciting. It's a new way of also sometimes coping with their pain or the condition at the same time developing a new part of
No, if video just pop up. Video pop up with
collaborations and partnerships. Governments cannot do it alone. So, Dr. Layo, I'm supporting you here, and Dr. Wellington. We are doing so well, we are doing your best. We want to also emphasize that you cannot do it alone. So it's partnerships, public-private partnerships, and partnerships even across all sectors. Remember that HIV, I keep saying that, HIV programming, if you remember, is multi-sectoral collaboration. So I'm doing that in this sickle cell space. Let's also try multi-sectoral collaboration and partnerships across all levels. Remember that also SDG 17 speaks to, number 17, it speaks to partnerships, local partnerships. But then it can have sub-global, I'm talking about national partnerships, partnerships across the regions, partnerships within various within companies, and it's the government, private sector, banks. Remember how banks work in COVID? They can also organize. So they can mobilize and jump in where health insurance has all worked. Okay? Banks, oil companies, churches, everybody needs to work together. So it's an era of partnerships, not the time when you're working in silos. Okay? So, collaboration Nigeria is bringing up. And let's be also emphasize, I've seen a lot of comments that Sickle Cell Foundation Nigeria should also look at other parts of the country, not only Lagos. But Sickle Cell Foundation Nigeria is an NGO, not a government. So we're not all over the country like Dr. Elias. Okay? We are all in Lagos, but we're trying at the same time to see that we partner with other people across other entities across the country. So there's a model that we are putting forward that we call the Waiting List Initiative. We have so many requests from ladies, from leg ulcer treatment to group replacement surgeries, admissions, payments. There's so, and we're going. Patients are paying out of pocket. Sickle Cell Foundation Nigeria is also paying out of pocket. So there's not sustainable plan for that. And that's where we are proposing this waiting list initiative. So anybody that we have an encounter with, anybody that we have an engagement with, physically or virtually, we will enroll inside under a waiting list. And that waiting list we will now share with those who can come on board and support. So for sustainability. Remember, government can't do it all. Remember, the HMOs are not able to do it. So then, let's see how we can have this waiting list initiative and let it work through working with partners across the country. And I'm looking at the private sector here. I'm looking at the banks. I'm looking at the oil sector. We have the money.
Samsung, you know what? Okay.
Work on this waiting list thing. And please, if your participants are listening, if you have any problem, engage with us. We'll put you on the waiting list.
I'm on more filler from Daniel of
and guess what? This is how we are going to be able to reach all.
I do my big for gas
it's public-private partnerships.
Gas cocaine.
Other NGOs, verified initiatives, similar NGOs across the country, so that we spread that tentacle and ensure that every person who has sickle cell disorder is taken care of in Nigeria, so in a sustainable manner. That's something I want to leave on the table today. Before we leave, okay? So, we want it to be a big cost. And governments know that you're not alone, we're working together. And I would like that the chairman will help us to tie all this together so that we have recommendations that we can put together as our community at the end of this meeting. Thank you so much, all the panelists and participants. Thank you, moderator.
Thank you so much, Dr. Ness. That was beautiful, laying out the strategic vision of the foundation and also the call to action in regards to partnerships and just the vision of Nigeria getting better, the outcomes for sickle cell disease. Thank you so much. Dr. Adikule, I know you also have chairman remarks, but for this panel, is there any final words you'd like to leave? And then we'll close with Ms. Nicola, how we started. Sir, you're on mute.
You know what, let me reserve my comments.
Okay.
Which are the comments with Chairman's closing remarks.
Okay, perfect. Thank you, sir.
Closing remarks.
So, Ms. Nicola, you started us beautifully with your presentation. How would you like us to remember, and what should we take home? What should we continue to meditate on and really ruminate on.
Thank you. I think for me, before it's the main categories, right? The first one, which I think Lakon has done a really great job on, is around hope. Hope for people living with sickle cell, hope for the future, think through for individuals around your mental state, and how a little bit of positivity can help shape the rest of your life. Same thing I can direct this, especially to parents, right? Because that foundation that you lay for your child and how you build them up in terms of what you think their limitations are, if you put any limitations on them, is going to shape the rest of their life, right? So for me, I'll start with that. That there's hope. And in terms of that hope as well, it's like looking at the future in terms of healthcare availability. There's never been a better time in the world to access. I know it might not feel like that because, I know it might not feel like that because if you're struggling, and I see a lot of people in the comments with chronic complications, especially like also as Delta fans, the vascular disorders are quite due to that. If you have some of those complications, it can feel really exhausting on your body, like you're constantly fighting from one thing to the other. So you escape this one, then another one comes, and then it's your eyes, and then it's this and it's that. And it can feel like the weight of the world is on your shoulder. But just think about the fact that never in the history of the world has there been a time of so much medical intervention for sickle cell disease, right? I know it might not always be accessible at the and it's still a couple of decades away, but there is hope, and there will be a time when people living with sickle cell can kind of have relatively good lives without all the money in the world. And I would like to end with piggybacking off what Dr. Ed said around healthcare financing, and I would like to address this to our government stakeholders. I would really like to put you on the hot seat here. We really need to do better for people living with sickle cell. In terms of healthcare financing, the constantly, like, I love what Dr. Ed said around the waitlist thing, but constantly paying for medical treatment out of pocket is mentally draining people living with sickle cell, draining their families, draining society. I remember there was a time I had a panel session with somebody, and they mentioned a comment that someone said that caring for a child with sickle cell is like pouring water down the well. And the reason for that is the financial part, right? It feels like the constant spending just to have, just a basic amount of life. So for me, we really need to get that healthcare financing part right. If there's an outcome I would really like to pursue after this call, is how can we create a level of not keeping our children here. And that's how I'd like to end.
Thank you. Beautiful call to action and wonderful summary. Panelists, you did a wonderful job. Dame Okoa, Professor Kalusi, Dr. Wellington, Dr. Shopeka, Dr. Adesile, and Dr. Annette Kishete. Thank you so much. Dr. Annette, I think we have to have a part 2 and a part 3 town hall because we have so many questions and people are still engaging, but we don't have time. So we're going to end our panel now. But I think the foundation will promise to do more town halls in the future to help us continue these conversations. Oh, yes, sir. Did you have a question? Dr. Adette? You're on mute. Okay. Yeah, there you go.
The tech team had mentioned everybody and these allows. I was going to say that the Sickle Foundation had a number of time.
Yes, okay.
Very briefly.
Yes, Vicar Hope Foundation. Sir, please unmute.
Okay.
Okay. Thank you, sir, for joining us. Please.
Thank you very much. I'm going to be very brief. I'm Dr. Chukwemeka Watama from Sickle Hope Foundation. I just wanted Sickle Foundation achieve the target state. Dr. Basil was able in 2018 to work to pass a law requiring that all everyone should have their blood group and genotype on their ID. Can you hear me?
Yes.
Yes. I think there's some technical. Okay. Yes. Please go ahead.
Okay. So Sickle Foundation was able to United States with the
Doctor, specifically, any specific thing you'd like to add to the conversation today? Because we can't hear you well.
Okay, let me do this.
Can you hear me?
Can you hear me?
Yes, very quickly.
Okay, yes. I said that Sickle Foundation was able to, in 2018, work with Abia State House of Assembly to pass a law called the Abia State Identification of Blood Group and Genotype Law number 5 of 2018, which ensures that everyone is required to have their blood group and genotype on their ID card. We believe that this will help to decrease the incidence of people getting married. They need to know their genotype before they get married. And they really appreciate the work of Dr. Nkechi and also commission with the help of the Abia State House of Assembly. Another bill, the Abia State Prohibited Law number 9 of 2019, Abia State Violence Against Persons Prohibition Law. This actually entails and ensures that the stigma that is apparent with people with sickle cell disease is reduced to the minimum. So these are some of the things, in other things that she has done, which I think can also help, and they maybe buy into.
Yes, completely. Thank you for sharing the beautiful work of Abia State and Vicar Hope Foundation. Very inspirational, and hopefully there's some learning and models that we can learn from the other states that are still trying to figure out how to get it right, how to get things right with sickle cell. So with that, we'll close our panel because we have some testimonials that Dr. Annette will be introducing those. So appreciate each of your time. Demokoa, did you? Okay.
Somebody she talked about how training it is to be able to take care of the warrior. One, and she knows what it is like. In Delta State, what we have done, we have the contributory health care scheme. So we in our foundation, we have been able to enroll so far for about 4,000 warriors. So that they can also assess health. This scheme, what it does is that they have free hospital admission for 7 days in a year. 7 consecutive times. So they go to hospital for 7 times, it's free.
In fact,
we also have free medications for
extremely encouraging. I don't want this battle to end. I can stay here for 2 more hours, 3 more hours. But unfortunately, we'll have to wait for part 2. So we're going to say goodbye to our panelists, and we'll only spotlight Dr. Annette because she will introduce our session. Getting you all for your time, and again, thank you for the honor for being with such wonderful, wonderful people.
Nǹkan tí mi lè wá ìwọ nìkan mọ bí wọ́n ṣe máa rí but wọ́n ní kò tẹ́ láti work towards it.
Annette, you're muted.
Are you on mute?
Jẹ́ ká sọ létà jọ mọ́ wa meeting jẹ́ ká sọ létà mọ́ wa meeting jọ. Má pẹ́.
Dr. Annette, please unmute yourself. Okay, she's working on that.
Who's the national director?
Annette. Okay, she has a
Okay.
She has the right to unmute.
Everybody has the right to.
Please go ahead.
She was struggling with it.
I wouldn't omit her because the only thing I can do is to ask her to omit. Do you understand? I can only ask somebody to omit.
No, thank you. It was very much an honor.
I disabled the ability for participants to unmute themselves.
You disabled it? Why? So you want them to come in?
No.
Yes. I also do that now.
No, it wasn't there before.
But I did that too.
It wasn't there before.
International professional rugby player.
So we are done now.
Eye contact,
from 300. Wow.
I'd like to have
and you subscribe for 1,000.
Wow. By the effective.
Just do 500. So get
3,000. In this Nigeria, the only thing people can do is to come in, go. Come in, go.
The best is just 500 for this kind of program. Exactly. You have YouTube, you have video.
Exactly, that's the best.
Once it's filled up, let's go and
go to YouTube. That's the best.
Are they receipts or Mrs. Oguno?
ADBC was ADBC.
Have you there?
This office is good.
You can shout, listen your voice.
Let me go and drink coffee.
This is ADBC.
Oh, Annette, if you don't mind, while they're getting ready, if I can give my closing remarks, because I have to.
You have ADBC very quickly. ADBC, 2 minutes, please.
Yeah, thanks guys for having me. Can you hear me?
Yes, we can hear you. Go ahead.
Thanks for having me. As you said, obviously I used to play professional in the UK for 11 years. My career obviously has sickle cell.
For where?
It wasn't obviously through my career, a lot of people, family was trying to get me to stop because they were scared about obviously me playing rugby and having sickle cell, but obviously I didn't do that because obviously I knew what I wanted to do, I really loved rugby.
But why did you drive?
It was really hard, especially with the fitness, with trying to keep up with normal people that play rugby, but obviously mental toughness was very key for me. And I always,
the back or the front,
both sides, that have kids with sickle cell.
Was there traffic? There was traffic.
Because if you're saying no, you can't do this, no, you can't do that. For me, when the child grows up, he's always
you're going towards
so he's always going to want to not do things and not being encouraged and things like that. So I think my advice to take to people that have sickle cell, if you have
just give them something. I argue with them before that. Just give them like it's okay.
Obviously, for me, play at the highest level, play for England as well at youth level as well. So I just wanted to come here and obviously say something to talk about.
I've asked her to, I wouldn't omit. Okay, she's omit.
And knowledgeable for me as well, because there's other things that I didn't know about as well that I learned today. So thank you, Sickle Cell Foundation. Thank you.
Let's push back now.
Good afternoon, everyone. And this is Martha Odumo speaking. Thank you so much, Sickle Cell Foundation, for having me. I don't know if everyone can hear me. Can you all hear me?
Yes.
Yes, sir. Okay. Okay. So thank you so much, Sickle Cell Foundation, for having me. It's such a pleasure and privilege for me to be in this meeting to share my experience with sickle cell disease. Just as I've been introduced earlier, I'm Mrs. Martha Ojuro by name. I'm a mother and a mother of 2 children. I actually had 3 children, but one is no more, so I have 2 children right now, and I have sickle cell disease. I'm living with sickle cell disease. I got diagnosed with sickle cell disease when I was a baby, according to what my mother told me. That about, I think about 5 months of age, I started this hand and foot syndrome. So my legs got swollen, and they took me to the emergency room. So by the time they got me to the hospital, they ran some series of tests for me, and then they discovered that, I had sickle cell. And I was actually born in 1976. That's, do some mathematics now, that's about 48 years. Actually, over 48 years ago. So at that time, genotype testing was not really common. And before people would go into marriage, there wasn't anything like check your genotype before you get married, like it is right now. So my parents got into marriage, and then had 3 children, and then when it came to me, whom I'm the 4th child, they discovered that I had sickle cell, and it was actually tough for them, because it was the least thing on their minds. My parents actually are nurses, or were nurses, because my mom is late, and my dad is retired. So they worked as missionary nurses in a local Christian hospital. So they totally understood what that meant, then. And by the time they ran all those tests, they also discovered I was anemic. So at the same time treating my sickle cell crisis, they also had to, treat the anemia that I had at that time. So it was quite challenging for them. But anyway, they now began to learn how to manage my sickle cell condition, and they did that so well. They garnered all the resources they had around them, and then being medical people themselves, it wasn't too much of a challenge for them what to do to keep me healthy. And I thank God also, because they still believed in me and the potentials I had. They restrained me from doing the things I should do. They sent me to a boarding school. I went to a boarding secondary school. They gave me all the support I needed, and kept encouraging me. And then I also, went to nursing school. I became a nurse after I graduated from secondary school, went into nursing school, and graduated. Did my midwifery as well. I'm a nurse midwife. And then I took some courses also in the UK and in the US, in nursing and in public health, So in the long run, I'm actually better equipped to doing what I'm doing right now. All the work I do about sickle cell, it stems from the passion I have in my heart, first of all, from the pain I have been through, because I have really been through pain. I mean, when Mr. Lincoln was talking, I I actually wanted to ask him a question that have you ever had a crisis? Because it sounded so positive, like he has been, not really had so many health issues of sickle cell like some of us, and then I wanted to know what his little secrets were, But for me, actually, I had a lot of sickle cell issues when I was growing up. Looking at me, actually, you won't say it. And that's just because of the many advantages that God put in place for me. First of all, for my parents to be medical, that was an advantage for me. And then my husband, I got married actually at a very early age. And I think that was also a blessing that God, put in place for me. And then my husband is a medical doctor as well. So that, helps to curb any health emergencies that came up and all the problems that I would have suffered. I didn't have to go through a lot of problems, taking care of my health because of all the support systems that I had around me. But actually, initially the crises were actually very frequent, and especially when I began to have children, when I started getting pregnant, it wasn't really easy initially because I didn't know how to, take good care of myself. I was still relatively young then. I had my first baby when I was 23 years. She's actually 24 years right now and a graduate of law. And so I'm so grateful to God for that. So it wasn't really easy for me at that time. I had a lot of blood transfusions in my first pregnancy. So, but God took time. The second pregnancy wasn't so, because I've already gotten some experiences from that first pregnancy. I had better learned then to manage myself and to take care of myself. And then I also, understood a lot of techniques, of what to do, what not to do, when you are pregnant, when you are not, how to live a relatively normal life. I just began to learn these things, most of them through experience, and then actually,
I have to thank you here because of time, We have to thank you for sharing. There's so much we can learn from you still, and I wouldn't mind really if you could send them very young, part of this session. Participants have learned from you. I think the common thread is this: that one, I heard something like know yourself, and then the parents, mothers and fathers who are primary caregivers of persons with sickle cell, they need to really encourage them, they need to believe in them, they need to know how to take care of their children. And so those are the things that keep reverberating, these issues of parents and knowing oneself. Thank you so much, Mr. Dumo, for sharing. I'm really grateful, and I'll be glad to hear more, much more. There's a lot we can learn from you. I want to share my email with you. I want to learn more about your life story, how you coped, how you did so well. Even though you said you had crises and all that. Let's hear more and then engage more with you. Thank you so much. So it's time now for me to call on the chairman, Professor Adekile, to kindly give us the closing remarks. And I believe that in giving us closing remarks, you're going to help us, bring everything together. Spaces, stuff together, so we know what we're doing away with from this meeting before the community. Mr. Chairman,
thank you so much, Dr. Kishan. One thing I don't like about virtual meetings like this is that we don't really show appreciation. This has been such a fantastic, so we really can't clap and tell the case. But this has been really exciting. It has been very informative and learned a lot. We had good remarks from quite a spectrum of stakeholders that shared their goodwill and other messages. But of course, the highlight of the session has been the panel discussion and Kulari was started it off. Well, first of all, I think Dr. Sickle, who was the moderator, did a fantastic job, and I really, admire the way she handled it. She was on top of everything, and she knew what kind of questions to ask and do the questions, and she got people to really be forthcoming and share extensively. So thank you so much for that wonderful job. Now, so many things came out, and I'm sure we're going to have a good community. But I will just look at some of the real highlights that occurred to me. First of all, one thing that has come out, especially from Lacon's sharing, is mental fortitude and the proper attitude to life. Because we all have issues. The moment we are born, we start to die. We all have a finite lifespan. So the thing is, how do we face? Yes, how do we face our challenges and what kind of spirituality we bring into one thing that we don't talk much about is how to actually develop that mental toughness. People talk about mindfulness, meditation, and things like that. These are things that we probably need to cultivate, especially for those who have health challenge that we're talking about. And of course, what really gladdened my heart in this whole session is that it was not all about and we have actually identified why that book is there. We're not being delusional, we're not just deceiving ourselves. There's real hope that advances. However, there are still challenges, and this is where sickle cell warriors,
like meeting already to fly me.
For the champions and heroes,
like meeting already to fly me.
You are your best so you need to form patient support groups.
What's over? Prepare over careful. Over careful.
Now, the governments are doing
otherwise we are fantastic.
Lots more.
I want anyone you. I want.
I just give you one.
I don't mess up this time. Mess up big time.
It did not improve until the government passed the Act for the Control and Management of Sickle Cell Disease. So until government is committed, you will not go, because this, we're talking about very expensive treatments, very expensive cases, and government just has to be committed. Okay, so we must have good advocacy to let outline what the challenges are and what government can do, especially in the area of newborn screening, because we know that is one thing that we need to change the trajectory of the course of the disease. Okay? Then insurance, people are paying out of pocket, and this is an expensive business. I mean, it's like going to the poorhouse, trying to look after patients with the disease. Therefore, there must be some way of refunding or reimbursing the expenses that patients go through or parents go through. Okay? Now, there are things that are out of our hands, and that's where what Dr. Prosperusi mentioned. The genetics of the disease is not that straightforward. Although every patient has the same mutation, because of the inflammatory and other mechanisms that go on, which are also under genetic control, so there are other genetic inheritances that affect how each patient is going to respond. Okay, so that accounts for a lot of variability that we see. But more than anything else is the care that the patient gets from an early age. And that's why I'm going to urge everybody, we talk about hydroxyurea, people get scared, patients get scared if they think about, oh, it was a cancer drug, maybe it will cause cancer, maybe it's going to depress fertility, maybe it's going to do this or that. Sickle cell patients have been using hydroxyurea for about 40 years in heavy doses. And we still do not have any clear-cut instance where the drug has been linked to any kind of malignancy. Okay? It is true that it suppresses actively growing cells, and that's where the sperm cells and ova may be affected. However, it is time dependent and dose dependent. So that's why we advise that, especially the men, if they want to get pregnant or have their partner get pregnant, then they stop taking the drug, and the sperm count recovers beautifully, okay? And mothers who are pregnant, or when they're pregnant, they are advised to stop taking the medicine because of the potential effect on the fetus. But even then, we still have not documented any teratogenicity where the drug has been linked to abnormalities in the fetus. In fact, some sickle cell patients who have been on hydroxyurea and their doctors tell them to stop. You see that they start having high. In fact, many of them now insist that they're not going to stop taking the drug even when they are pregnant, and they've had many babies that have been documented that have been completely normal. Okay, so, but the final thing I'm going to say is that advocacy is so, and we all have to contribute. If we don't leave it to the patients, we don't leave it to just the doctors, the whole society, policymakers, schools, and all aspects of society have to be involved. Sickle cell disease is our problem, it is our heritage, it is our legacy in Africa, and we all have to be on board, to offer a better life to our patients. So let me stop there, then let me again Sickle Cell Foundation for putting on this wonderful town hall, and I hope we'll have a good community and be able to influence policymakers. And let me again thank the state government, especially Delta State, Abia State, Kaduna State. They are already taking the lead and they're taking it. So thank you all.
Lagos.
Lagos, yes, please. Thank you.
Yes, thank you so much, Chairman, sir. I'm really grateful that you accepted to be part of this today. I don't know who would have shared this more beautifully than you and contributed meaningfully. I saw Mr. Kolo now. I'm so sorry, Chairman. I'm having to say something after you have spoken. Mr. Kolo, Comfort Okolo. Comfort Okolo, are you there? I wanted to. Mrs. Comfort Okolo, genetic counselor, trainer. A trainer from London. Mr. Can you unmute and say a few words? Mr. Kolo is a trainer of trainers, genetic counseling. So she's trained genetic counselors from us in Nigeria, from all parts of Nigeria, and even beyond that, Nigeria. She's based in the UK. So just a few words. Your hands are up and I've said yes, speak.
Yeah. Okay. The line of the song that comes to mind in all of this, playing with the dance of the song. I'm not going to sing because I sent everybody away. It's just Ejeka Sowoko Katun Washe. Let's put our hands together. Katun Washe. Yes. If all of us our hands together to help people with sickle cell disorder.
I can't hear you.
You can't hear me? Oh boy.
I'm losing Mr. Kolo as well. Audio.
Can you hear me now? Can you hear me?
Better, yes. Better.
We can hear. Can you hear me?
Yes.
Clearly. One of the basic things that needs to happen at home is free folic acid, penicillin, immunization for our children with sickle cell.
Thank you.
There's enough fund in the country to actually be able to fund that. That would be a very strong beginning for all our children with sickle cell disorders.
Thank you so much, Mr. Kolo. We're grateful that you joined from London. I also wanted to say that the representative of Sickle Cell Support Society in Nigeria, you were cut short in the middle of your remarks. Can you send your speech, your address, and just please pass our love and best wishes to Professor Nodu. Thank you very much. And then I see that Professor Laura Akiola is here. We have to acknowledge her presence. Professor Laura Akiola.
Yes.
Who is doing great work.
Laura.
Yesterday they had your work. Please can you spotlight Professor Laura Akiola?
Laura I mean, Akinola.
Oh, bro, please, can you just speak from wherever you are? Or reach yourself and speak.
Mary. Okay, Nora.
Okay, I didn't see. Maybe she's not there anymore. Maybe Papa's left. All right, the community of Little Stars is next. Mrs. Popola. Mrs. Modique Popola, where are you? Popola. You are supposed to give us the vote of thanks.
Popola.
Who has the communique?
Modique, right?
Yeah. There has to be something to give, but when the chairman's wrap up is adequate, so whatever we piece together at the end of this. Okay, let me just call on Mrs. Modique Popola to give us the vote of thanks. To thank everyone, but before that, just to reiterate what's going to be in the communique from what the chairman said.
Oh,
this issue.
What a great gathering.
Please hold on a moment, Mrs. Modique. The Sickle Cell Champions needs to be organized. That you are your best, with your own best advocates. Government cannot do it all. We need to be to work with government, and also we have to ensure that we, in a way, hold government feet to the fire. But we need political will, government commitment, health insurance, and then care. The fact that care of patients is from a very, very early age is paramount. Advocacy is key, and it's everybody's problem. All Nigerians. Sickle cell is a Nigerian so we have these small hands on deck, and
should I come and check? Or and I wouldn't want to feel as if I don't know what he's doing.
So Mrs.
Mama was disturbing me.
Take it away, please. With your thanks. Thank you.
Thank you so much. What a great gathering. It's a wonderful one. And what has a beginning definitely has an end. But I don't think we can end this without expressing our gratitude to people that are worthy.
Agreement that was they just played the first stanza.
Distinguished guests, ladies and gentlemen.
Boy, mom, I stop
as we conclude
the
enlightenment and impactful.
Play everything.
That's what they said.
Virtual Sickle Cell Day 2024 virtual Townhall meeting. I wish to express our heartfelt gratitude to all who have actually made this possible. A special thanks to all the organizers, the Sickle Cell Foundation Nigeria, under the leadership of our chairman, Chief Sunday Afolabi, MFR, our founder, Professor Olu Akinyanju, OFR, and our National Director, CEO, Dr. Annette Akinchese. Our appreciation to the chairman of the occasion, Professor Adekile, a renowned professor of pediatric hematology, University of Kuwait, for the exceptional guidance. We say a big thank you. We also extend our sincere thanks and gratitude to our sponsors, Pfizer, for making the event possible. They made it possible through the their financial support and their the healing blend. We say a big thank you to you as well.
The recording is online, it's on the platform.
To our behind, Our Excellency Dave Edith Popowa, Dr. Alayo Solekon, Dr. Abosede Wellington, Lekon, our ambassador, Professor Adeyinka Falusi, our mama, Mrs. Bukola, and our voluntaries moderators, Dr. Titi Lope. Your insights were invaluable.
But this meeting you did now, at least you will collect on.
We acknowledge all our partners as well and representatives who took part in this event. United Nations, the WHO,
giving back to the society.
Federal Ministry of Health, Lagos State, the Ministry
giving back
of Health. 05
at least the society puts him to where he is.
NCD Alliance, give kudos to you. The medical